just want to thank all of you for being here, and we have many participants who are joining us virtually, including the Praava team, members of the Praava team who couldn't be here with us. You're going to get a chance to meet a few of our other colleagues later today. Dr. Samin, our Chief Medical Officer, and Dr. Zahid, our Senior Lab Director, are here with us in person, and hopefully you'll get a chance to say hello if you didn't already to those of you who are here with us. I think it's really wonderful that we're able to have so many virtual participants. I think we have more than 80 people who are joining from all over the world, and it's really a testament to the world that we're living in now, where we're all engaging with each other both in person and virtually. And also an interesting ode to the work that we've been doing and how even Praava's work has transitioned more into a hybrid model in the last few years. We want to kick off today with a short video that will be a virtual visit to Praava. A few people in the room have been to Bangladesh and been able to see it in person, but many of you have not. So we just wanted to take the opportunity to share it with you visually. William, can you please tee up the video? Bangladesh is one of the world's fastest growing economies, with the GDP per capita surpassing India's 2 years in a row. As the world's 8th most populous country, Bangladesh's rapidly growing middle class is driving consumer demand and powering economic expansion in nearly every sector. Praava Health is proud to be contributing to the growth and modernization of Bangladesh with an array of innovative world-class quality healthcare services that has changed expectations and disrupted the industry for the better. Welcome to Praava Health. I founded Praava Health on the belief that everyone deserves access to affordable, high-quality healthcare that they can trust. We're on a mission to change how healthcare is delivered in Bangladesh and beyond. We want to revolutionize patient care and family health with levels of exceptional service never seen before in this country. For too many, the typical healthcare experience is disjointed, it uses little technology, and it only provides care after health problems have emerged. But Praava is changing this with a value-based healthcare system where the patient is at the center of care. Let me show you around our flagship facility, where our team works relentlessly every day to uphold our values and create excellent patient experiences. We are building a culture of preventative care that keeps people out of the hospitals and healthy through a full suite of integrated outpatient services. Within the Praava system, a patient can access family doctors, women's health, pediatrics, as well as advanced specialties, including cardiology, gastroenterology, dermatology, and others, plus outpatient procedures in these specialties, as well as in-house lab testing, imaging scans, and pharmacy. We are a one-stop shop for outpatient care in Bangladesh.
My husband and I, in fact, my family, we've been coming to Praava Health since 2018. And we have had a history of back pain. We get physiotherapy here, which is absolutely probably the best that I have had here in Dhaka. And we do our annual checkups and everything else here. You name it, we get it here. And we have 2 children. One is 2 and the other is 6. So I need pediatricians very, very, very frequently. And my mother-in-law, she has a lot of ailments. She is cancer recovery, she is diabetic, she has hernia, she has glaucoma. So all of this, you know, the only place we always go to and we always think of is Praava. And Praava Health has actually become another name of trust for us, to me and my family. And I wish Praava Health all the best.
I met Silvana in 2017, and her dream became my dream. In Praava, we've been able to reproduce some of the best practices that are used globally in healthcare. And this has helped us to create a unique difference in the patient experience for our Praava patients. And this has never been done before in Bangladesh. Silvana's commitment to excellence at every level of the organization has given us the freedom to support and care for the patient at the highest possible level.
প্রাভা বাংলাদেশের মধ্যে একটি উন্নত মানের চিকিৎসা সেবা প্রতিষ্ঠান। আমি এবং আমার পরিবারের সবাই প্রাভার চিকিৎসা সেবা গ্রহণ করছি।
এটা এমনই একটা স্পেশাল প্রতিষ্ঠান, আমি যতই অসুস্থ হই না কেন এখানে আসলে পরে এর পরিবেশ সার্ভিস পেয়ে আমি অর্ধেক সুস্থ হয়ে যাই।
Doctors don't give enough time. That's the main complaint in Bangladesh. But here at Praava, we ensure that each patient feels comfortable, that they are listened to, and that we give enough time to each patient that we see.
I've practiced in Iran, Saudi Arabia, England, and many other countries of the world. At Praava, only there is a quality service for the whole member of the family.
Recently, I fell sick, for which Praava provided me with a doctor who was able to do the right diagnosis, followed by a surgery at our external hospital. Once I was released from the hospital, I needed intensive nursing care full-time, which again Praava provided. Praava was with me throughout my entire clinical journey. When it comes to healthcare, Praava is my preferred first choice. I do my dental, physiotherapy, and annual health checkup from Praava, which is important in my line of profession.
I was first introduced to Praava as a patient when I lived in Dhaka, and I immediately fell in love with the business. We've really been leveraging up technology to better serve our patients. When the pandemic first hit, we rolled out services like telemedicine and e-pharmacy, so customers and patients could access their services from the safety of their own home. We're currently combining all of our services into a patient super app, which will be the one-stop shop for patients to avail remote and virtual services.
85% of the world's population lives in emerging markets. McKinsey estimates that for each dollar of healthcare investment, low and middle income countries achieve a $4 increase in GDP. By starting our expansion journey today, we can help more people within Bangladesh and across other similar economies to change lives for the better. Join us on this exciting journey as we innovate at the cutting edges of healthcare globally, starting here in Bangladesh. If you had an opportunity to create a healthcare system from the ground up, what would you build? A few years ago, I became obsessed with the problem of healthcare after having a really jarring experience with my mother when we were visiting Bangladesh for a family wedding. Like many of you, I've been very lucky to have access to arguably some of the best healthcare in the world. But even in some of the richest, most quote-unquote advanced economies in the world, we see that care is failing us. So I started thinking that there should be a better way. So I'd ask for you to imagine with me, if you had the opportunity to build a healthcare system from scratch, how would you do it? And imagine that you had the opportunity to do it in a country that's young, underdeveloped, overstretched, where healthcare is failing its citizens, where the average amount of time doctors spend with patients is 48 seconds, where there's only one internationally accredited lab for every 40, what is happening, guys, with the presentation? But the presentation is moving and I'm not pressing it. Sorry. It's just like playing.
It's gonna be great.
Yeah, sorry. So the average amount of time doctors spend with patients is 48 seconds. There's only one internationally accredited lab for every 40 million people. 15% of drugs in the market are counterfeit. And patients are carrying their medical records around in bags and suitcases. So we're really starting in a green field. And I thought there's a lot that we've learned from healthcare in the last few decades. There are people here today from whom I've learned. And collectively as a community, I think there's 4 things that I picked up when I started doing this thought experiment. Number 1, primary care has a tremendous capacity to improve outcomes, but it has pretty bad economics. Number 2, diagnostics is the most profitable part of healthcare. Number 3, digital health alone cannot serve all a patient's needs. Number 4, lack of access to quality healthcare is a bigger cause of death than lack of access to care alone. So what can we do with all of these lessons? We considered every possibility. We looked at building a primary care clinic, or building a diagnostic center, a pharmacy that guaranteed access to quality drugs, or just building an app, an Uber for healthcare. We finally realized that the best system was the combinations of all of these things. A system that allowed us to serve a patient's needs throughout the course of their life, and a system that allowed us to own the entire patient journey. The presentation is just going again, just so you guys know. We had the opportunity to apply these lessons in a way that had never been done before in a market that really needed it. The 8th most populous country in the world, with an underdeveloped healthcare system and excess demand for quality care. And in a country that's experiencing sustained economic growth. So that is what we went on to do. I'm gonna pull up the next slide now. We're transforming healthcare in Bangladesh in a way that we've never been able to see before in an emerging market. It starts with the patient at the center of care. We are there for our patients when they need us. It's the ointment you need for your daughter's rash, or the ECG your father needs because he's experiencing heart palpitations. It's the health check that you and your partner try to get every year. It has 2 parts to it. It includes the quality infrastructure underpinning the healthcare system, as well as the technology around and supporting those services. We like to call that the brick and the click. So the brick, it's also going without my pressing it still, just so you guys know. The brick actually, the brick starts with primary care and secondary care. So that's consultations with family doctors, women's health, pediatrics, dentistry, ophthalmology. Advanced specialists as well, cardiologists, gastroenterologists, orthopedics, dermatology, and outpatient procedures in all of those areas as well. We've also built 6 in-house labs, including, thanks to Dr. Zahid, the first molecular cancer diagnostics PCR lab in Bangladesh. Full range of imaging services as well as in-house pharmacy, and everything is set up according to international standards and quality. Our lab recently achieved international accreditation for the first time. Thank you. Thanks to our team. Our pharmacy sources only directly from manufacturers to eliminate the risk of counterfeit drugs, and the doctors are practicing protocolized medicine. Everything is then layered in and embedded in technology. That means we brought Bangladesh's first fully integrated hospital information system, which features the first patient app that Bangladesh has ever seen, which includes medical records, appointment bookings, as well as additional digital products that we've rolled out. COVID preponed the launch of all of those things: telemedicine, e-pharmacy, and remote care management. So this is what we've built. I think it sounds like we're ready to start with General Petraeus, which is great. I'm going to come back to this after. Unfortunately, we only have his time till 10 a.m. So we'll start with him and then come back to our presentation. I'll just introduce him in the interest of time. As all of you know, General Petraeus is a retired 4-star U.S. general and the former director of the CIA. He has served in the U.S. Army for nearly 4 decades before his retirement. And he's currently the head of the Global Institute at KKR. And he's been a personal investor in Praava since the beginning of our journey. You've been an investor in your personal capacity since the beginning of our journey. Can you tell us a little more about your personal approach to venture investing?
Yeah, it's pretty straightforward. I evaluate the leader and the big idea. The leader, can that leader build out this powerful big idea, assuming that it is powerful? And I found your big idea very powerful for all the reasons that you've explained to the audience about the size of Bangladesh, the growth that it has achieved, the density of population, the growing middle class, the need for what it is that you provide. And then candidly, I've always been impressed by you as a leader and sense that you would be the kind of person who could actually build a company and continue to lead it. So not just a technology person or somebody with a big again, big strategic idea, but the ability to actually develop that big idea, build a team, which you have also done very, very impressively, and essentially operationalize something that seemed to be very compelling. And, you know, I'm invested in about 25 or so startups, and that's beyond separate from the KKR investments that we were involved in. And again, yours seemed very impressive. It was intriguing. It was even exciting to see what you were going to provide for your country. And it has scaled very impressively, whatever the metric is, whether it's revenue, the size of the team, the size of your patient base, the way that the products and services have evolved, all of that has been very, very impressive. And that's why we have invested in subsequent rounds. I think we're maybe a 3-time investor now, something like that.
I think so. No, thank you. Thank you for having that faith in us. I'm curious how you think about the general investment climate in Bangladesh.
I think it has both strengths and weaknesses, candidly. I think clearly the explosive GDP growth has grown faster than China, I think, over a certain period of time. You mentioned the per capita GDP compared with India, where we're very big investors as KKR. But obviously there are issues periodically with a variety of challenges that you find, I think, in any developing country, which can relate to governance and so forth. Although the issues that Praava has experienced were ones that were negotiable, if you will. You were able to navigate your way through those successfully and come out the other end better, I think, for the experience. It's also where some individuals, perhaps like me, can help from time to time by making sure that folks at rate levels understand that there are issues created for a really promising firm that's providing something that Bangladeshis very much need and want. So again, I think you have to have a measured approach to this. My hope is that over time we'll see KKR follow. Obviously, we're looking always for much, much bigger deals in different sectors. But again, what you're doing is very, very compelling, exciting, and actually I think it has been proven now. And so the promise is more real, I think, than it ever has been during the course of this journey.
Absolutely. No, I'm curious if there's anything you'd like to share with the group, given that you've had a chance to spend some time with our management team as well. General Petraeus generously did some leadership trainings with our team. Any observations you have or anything you'd like to share that you think they might not otherwise know about us?
Well, first of all, starting candidly with you, I'm a reasonable student of strategic leadership. As you know, at one of your alma maters at Harvard, I was a fellow for 6 years at the Belfer Center, and we built a model, an intellectual construct for strategic leadership. And having been a strategic leader several different times in my government career, for example, during the surge in Iraq most prominently, you have to get the big ideas right, the strategy right. You have to communicate that throughout the breadth and depth of your organization and also to other stakeholders, clients, and so forth. You have to oversee the implementation of the big idea. In other words, you have to drive the implementation of your campaign plan. That's hiring, firing, it's your example, it's your energy, it's your sheer determination, which has been very, very impressive as well, even in the face of, occasional challenges. That's where you're focused on metrics. That's where you're focused on various elements of what it is you're trying to do. And then you have to have the determination, the foresight, the commitment to be a learning organization. So you have to sit down periodically and formally and ask, how do we need to refine the big ideas so that we can do this process again and again and again? And that's all applicable, whether again it's the surge of Iraq or it's Alibaba or Amazon or what have you. You can look at this, what they do through this model. And I think that as a strategic leader, I think you've actually performed these 4 tasks very impressively. Beyond that, again, I think you have assembled a very impressive team. And it is all about the team and then teams of teams within that and so forth. And you seem to have been able to create the kind of culture that one wants to see, where people are working together, they're all pulling in the same direction. I think you have the same rule that we have at KKR, which is the no jerks rule. And, I try to identify that during the hiring process and wave them off. And again, a team that just patiently, persistently, impressively continues to build, work, expand, grow, and deal with the issues that come along in a very professional manner. And again, that is very, very compelling and very impressive. And I think now we're starting to see the numbers validating, the impression, because it's been, 6 long years at times. And now you're starting to see the kind of scaling that one would always want to see, and has to be very, very encouraging to you after all of these years.
Absolutely. No, we're really heartened. I mean, it's incredible that we've served more than 350,000 patients, and we're excited about the next phase, which we'll continue to talk about today. I wish you could be here with us, General Petraeus. I know that you have a meeting you need to get to, but
Yes.
just want to thank you for your time.
No, it's really a pleasure to be with you, and again, to sing your praises. You're a very
Very
impressive
kind.
leader.
Thank you so much for your time.
You bet. Bye-bye.
Great. I think we can continue then with the presentation, Jessica and William. Should I click through? Okay. We'll have a little more time for Q&A this way, since I already covered the beginning part, which is great. I think we'll jump. I think I've shared broadly the model. You can see here a photograph of our flagship facility. Many of you have seen this photo, which is in Dhaka, the capital city of Bangladesh. More than 23 million people live there. You can also see a photo of our app, which is the first of its kind in Bangladesh. We have served more than 350,000 patients to date. And just to place that into context, that's larger than most healthcare systems in the United States. More than 1,100 corporate clients, including the likes of Unilever, Chevron, the World Bank Group, the WHO, MasterCard. We have an army of more than 450 people that's building this dream every day. And you got to see a few of them in the video. Our Net Promoter Score is 91, which many of you will know is higher than most Fortune 500 companies. And within the context of healthcare, as some of you will also know, it's quite high. 30 to 40 is considered very good in healthcare. It's hard to make people happy in healthcare. On the numbers, last year we were at 8 million in revenues, and we achieved EBITDA profitability for the first time ever. We've been growing since the beginning of our journey, an average of 20% month on month. So we have proven this outpatient model, and we've done so in a market where no one else is owning this space. The massive patient acquisition that we've achieved is really just the beginning of our journey. More than 350,000 patients, and we're here today to try to get everyone excited about the next phase of our growth, which we think can be really catapulted with the next phase and the next injection of capital. We started in our first market, Bangladesh. Bangladesh is an extraordinary opportunity. It's a huge market, more than 170 million people. It's the 8th most populous country in the world, and also one of the fastest growing economies in the world. As General Petraeus pointed out, the economy's been growing faster for a longer period of time than even China. As a result, what you see across emerging markets, where the economy is growing so quickly, you have the health sector growing even faster than the economy. And so the health sector is growing at 10% CAGR. There's tremendous pent-up demand for quality healthcare services, and the local supply is not being able to meet that need. As a result, and also because of the lack of quality options in the country, you have billions of dollars a year and thousands of people every day leaving the country to access better healthcare abroad. 72% of health spending in Bangladesh, and this is true across most of South Asia, is coming from the private sector, which is very different than the rest of the world. The private sector is really filling the gap when it comes to this excess demand. But despite that, there's no clear market leader. Less than 10% of the market in Bangladesh is dominated by the largest players. So what is the current state of healthcare in Bangladesh? Care is extremely disjointed. It's fragmented. We've mentioned the 48-second appointments, the unreliable diagnostic testing, the counterfeit drugs. Care is really hospital-centric, and there's nobody who's owning the integrated primary care space, and there's nobody who's owning the digital health opportunity. Care, instead of keeping people out of the hospital, is driving people into hospitals. I'm not sure what's happening, but it still keeps advancing the presentation. Praava, on the other hand, is offering elevated patient experiences, more than 15 minutes with your doctor. Tech-first products that bring care to where patients need it, international standard drugs and tests. Smart use of data that helps patients to manage their health and improves outcomes with a value-based care model that keeps people out of the hospital. All of this helps us to build trust and loyalty over time, and that results in long-term relationships and value. All of this is important not only to ensuring the health of our patients, but it's also the foundation of a business and a brand that's going to stand the test of time. From a business model perspective, what have we learned? We believe that by owning the supply chain, we have a better opportunity, two opportunities. Number one, we can own the quality. We can guarantee the quality of the services that we offer in a market where that's challenging. Number two, we can also own the economics. So if you look at, in most markets, different pieces of the outpatient experience are owned by different providers. So look at the United States, for example, where we're sitting today. You have Teladoc for telemedicine. You have One Medical for primary care, Quest Diagnostics and LabCorp for your lab testing, PillPack or CVS for pharmacy. Praava owns all of the services offered by all of those providers under one umbrella. In that way, we're able to be a one-stop shop for all of our patients' needs. We're also able to own the economics. So two of the really common channels through which we acquire patients are consultations in primary care and pharmacy. As you can see here, these are strong margins on those segments of the business, 11 and 12%. However, they're not as strong as the margins of the other parts of the business. But by owning those channels, we have the opportunity, where needed, to push our patients within our own system to access diagnostic testing, health checks, and all the other things that they might need that are higher margin products. By building trust and loyalty over time, we're able to serve all of the patients' need over the course of their lifetime. You may not need a test today, but you might need a test once a year when you do your annual health check, for example. All of this leads to a compelling blended gross margin of more than 60%. This ultimately offers us better economics than the individual standalone businesses that I mentioned can possibly achieve. The patient experiences that we offer are what help us to create long-term value and family loyalty over time. Acquiring one patient is about $30, and over the course of 5 years generates a 9x ROI. Now, we haven't been serving patients for 5 years yet. We've only been around for a little more than 4, but we expect to be around over the course of a patient's lifetime, which will generate an even higher ROI. So Praava is primarily a consumer business for this reason, but it's also true that the consumer piece of the business is compelling for other reasons. If you can attract one patient, especially, let's say, a young woman who's making household decisions in healthcare for her entire family and is a trusted member of her friends network, that can help us to increase the ROI on one patient acquisition by an additional 10x. So the power of the friends and family network is not to be underestimated, especially in our market. Getting back to the business model, the lab is the main asset and the heart of the business. As you can see here, it is the most profitable part of the business, but it's also the biggest single segment of the business. Our providers are not incentivized to drive volume into the lab, but where needed, patients know that they can access quality testing that they can trust. The lab also offers a major competitive advantage to us. We operate one of 5 internationally accredited labs in Bangladesh. I'm going to put this in context for you. That means there is one international standard lab for every 34 million people in Bangladesh. When I compare that even to India, India has 55 times that level of per capita testing. And the United States has 34,000 times that level. So this is a massive opportunity for us to dominate the market. Again, by owning the primary care piece and owning the entire outpatient care experience, we have the opportunity to improve the economics of our business. So our economics is better specifically than standalone diagnostics companies because we acquire our patients more cheaply within our own primary care network. Technology also helps us increase access to care through new channels. So I mentioned that we have a patient app. We're launching a patient super app later this year, which will bring together all of our digital products in a one-stop shop on your phone in the same way we have a one-stop shop in our facility. This will include telemedicine, a digital concierge for remote care management, ability to order home sample collection and other testing, as well as e-pharmacy and beyond as technology continues to advance. Technology also helps us to improve the business's operational efficiency over time and helps us to think more carefully about data monetization, which we're already having conversations around with some of the advisors who are here today as well as our team. It also helps us to drive clinical quality, which you'll hear a little more about later today. We have an incredible leadership team. I hope that you'll have a chance to meet them later today, so I'm not going to get into all of their incredible credentials, but we're poised to take this business to the next level with this team. So what's next for us? We're targeting a domination of 4% of our market through digital and physical expansion in the next 5 years. Right now, we estimate that we own 0.1% of our market. So this is not a lofty aspiration, but we think we can do it. The digital expansion of the click side of the business includes the launch of the patient super app and really perfecting those online and offline journeys and the combination of the two. We're also transitioning off of what is currently a primarily outsourced hospital information system onto a proprietary EHR system, which is a FHIR-based EHR, which allows it to be interoperable. That EHR will have some outsourced components, but some will be inbuilt as well. We're also building a bespoke data warehouse, again, which will help us improve operational efficiency and think through data monetization for the future. On the brick side of the business, we also look to expand the physical infrastructure. So over the course of 5 years, we'd like to establish 55 clinics across Bangladesh. That will include 4 hubs. So the hub is what you saw the photograph of, the 10-story building, the full suite of your services, and 55 spokes. So the spokes look more like a One Medical or a Fullerton Health, a primary care physician's office where you can see a doctor, you can draw blood, get a basic x-ray, and buy drugs. The labs are sent to the hub for analysis, and you are referred to the hub if anything more advanced is required. We'd also like to build out additional collection points. We already have collection points across Dhaka City and even beyond, dozens of them actually, and this is kind of the Quest Diagnostics or Metropolis side of the model, whereby we partner with providers for lab collections. So we'd like to continue to build that out as well in the coming years. We're raising $15 million for this next phase of the business. So that will include the physical and digital expansion that I mentioned. Specifically on the physical expansion, that will help us to get started with 8 spokes within Dhaka City. We want to really establish ourselves firmly within Dhaka. You'll hear later today about a concept called the density dividend in Bangladesh because it's a very densely populated country. If you can really prove a brand in the capital, it makes it much easier to scale across the city. So we're really doubling down on Dhaka today. Driving volume through the patient super app, growing out the B2B channel. We'd like to expand the e-pharmacy to an e-commerce site, which it currently is not. And we'd like to deepen brand awareness. We are very proud to have built what is truly a household name in Bangladesh today, certainly in Dhaka. But more education is required to help people to understand the breadth and depth of the services that we offer. So you can see a substantial component of this is marketing. And finally, we are investing in bolstering our in-house training capacity as well. All of this is going to help us to really catapult the growth that we've already seen. So if you see here, this is the performance of one flagship hub in the first 4 to 5 years. With the injection of capital, we expect to be able to get to more than 210 million in revenues in the next 5 years' time, which is 30x revenue. And our profitability will improve over time as well. This will also aggressively help us to achieve patient growth. Our projections estimate that within 2 years' time, we will have served more than 1 million patients, and at the end of 5 years, more than 5 million. So where do we go from here? Immediately, we're focused on Bangladesh. But we do believe that we can apply the same lessons that we've learned and the approach that we took in terms of taking what we know works and how it works and adapting it to the local context across emerging markets. Specifically on the technology side, we have a huge opportunity because we don't need to adhere to HIPAA regulations, which can be very onerous. In our market, patients own their records. I think that creates a big opportunity for us as well, and that's true across most emerging markets. The emerging market opportunity is not to be underestimated. Of course, income growth is growing. In terms of health spending, in the last 2 decades, we've seen out-of-pocket health spending grow by more than $15 trillion, 66%, and that trend is expected to accelerate and continue. I'll stop there. I'm sure you guys may have many questions. How much time do we have left? 10 minutes. So we have 10 minutes for questions, and I really hope, I didn't get to say this at the very beginning, I really hope this is going to be a really interactive day. We're going to be taking questions from the virtual audience as well as those of you who are here in person. So it's not just stuck to these 10 minutes. We're going to have roundtable discussions, and so hopefully this will be a discussion. Yes?
A little bit about how, is it all like money coming from people individually to pay for services? Is there an insurance component? How does the corporate part of it work?
Thank you. Just to repeat that question for the virtual participants, the question is, how are people paying for services? What's the insurance scenario? So there's very little insurance in Bangladesh. Only 1% of the population has health insurance, and most of that is hospital care and inpatient care. Very little coverage for outpatient care. So I will say Praava's introduced an outpatient healthcare type product, whereby you pay a flat rate for unlimited access to outpatient services. The price point for that starts at $40 a year and goes all the way to $350. But that's our product. So insurance doesn't really cover our services. There's a few insurance providers, smaller ones, that do cover one annual health check with Praava. We're looking to partner with MetLife on actually that by the end of the year, hopefully. But what has grown in recent years due to COVID, which has been a really positive trend, is corporations are paying for healthcare services for their employees, which was really barely happening pre-COVID. Pre-COVID, less than 2% of our revenues were covered by corporate clients. But in the last 2 years, more than 20% of our revenues have been paid for on behalf of their employees by the corporations. Stephanie.
Following up on that, Savannah, when you talked about that, one of the big advantages.
We have a mic, sorry. Yeah. Thank you, KJ.
Impatient. So when you talked about sort of at the beginning that one of the big benefits of Praava and the healthcare you're providing is keeping people out of hospitals in the first place. So when you talk about who's bearing the cost of hospitalization now, and so who stands to benefit by investing and providing care via Praava in the first place, how does that model work?
So I think that individual families and households stand to benefit, right? Because healthcare costs go down if you are getting a health check every year and you're picking up on any issues you might have before you need to be hospitalized, right? But the hospitals don't certainly stand to benefit, right? And so that's the challenge. I think the current system drives people into hospitals, and although there are insurers for 1% of the population, most people are paying out of pocket. And the number one reason a family is falling back into poverty is a health incident in the family, because they're having to sell land or do whatever they can. Any of us, right? We will do whatever we can to get the best access to healthcare we can for ourselves and our families. And so I think the benefit is for the individuals, given that they're the ones who are bearing the burden in most cases. It's really not even the insurers. Now, the insurance companies stand to benefit from partnering with Praava on access to primary care for their it's the capitation model that's so popular here in the United States right now, right? But the challenge that they face is they don't feel they have the data. And that is one of the big challenges that insurance as a sector faces in Bangladesh, is there's not great data there's not great mortality morbidity tables in our market. And it's the changing population, it's a more middle class population than it used to be. There's a lot of data on the masses, not so much data on this new middle class, which is suffering more from chronic disease than infectious disease. Sorry, do we have anything from the virtual audience? Okay, no, great.
Thanks for that great presentation. So you talked about scaling with this next round. Can you talk a little bit about your operational discipline? How will you maintain standards and quality, the training and education of your staff, right? So that brand recognition continues to, you maintain that brand position in the marketplace.
Thank you. I love that question. I love operations. It's probably my favorite part of the work, and these guys will probably attest to the fact I get overly involved. But I think we're very process-driven at Praava, and we have been since day one. I mean, in the very early days, we invested in the person who's now with us as transformation officer, Manav Chowdhury. He came and sat with us. We sat in a room, and we drafted out every process for every potential patient journey at Praava. Now, we've learned a lot, and those have changed. Those processes have certainly changed. But I think being process-driven has served us really well. And I'll give you a really specific example of that. So when COVID hit, we were one of the first private labs to get approval to do COVID testing. And we went from getting 400 calls a day to our call center to getting thousands of calls a day, and people weren't even getting through. And there was one point in time, and we all remember what spring 2020 was like, where if you wanted to get a COVID test from Praava, you had to wait a month. I mean, literally, it was ridiculous, right? And we were letting a lot of people down. We were letting people down not only because they had to wait, but even our services weren't at the Praava level that we're used to. And it was very, very disappointing to me personally, but I do think a lot of healthcare systems all over the world faced similar challenges at that time. But what it did was it highlighted the weaknesses in our system, and it forced us to look at them and fix them. So we brought back Manav. He became full-time with us from that time, spring of 2020, on process design, and we figured it out. And what we've seen with each subsequent surge, when our volumes inevitably go up, with the most recent surge, that's the best example I can give you, our volumes doubled in January. And more than 30% of our staff contracted COVID. So our capacity went down. Service quality and complaints were flat. So I think we have really figured it out, and that to me is the best testament to the fact that we're ready to scale. But it's all about being super process driven. I think very hands-on mentoring of second level managers. We've built up that level of the organization now. And when we launch our first spokes, we will have to go sit at those spokes, in the early days, I think, and make sure that we've properly disseminated that. So I think it's about being really hands-on and thoughtful during the process. Please let me know when we're at time. Thank you.
My name is Tareen Anwar. I'm an executive recruiter on Wall Street for the last 40 years.
Great to see you.
Same here. Two-part question. First, congratulations. I have used Praava from here for my mother and our household help. That was terrific. And when I was in Bangladesh in December, I used Praava for COVID tests, and it was terrific. So please pardon me. I'm going to ask a humorous question first and then a serious question.
Sure. I know you love the jokes, Tareen Bhai.
When I saw your video, I was reminded of Elizabeth Holmes and Theranos, and you don't wear, the black turtleneck all the time. So was she ever your role model before she became infamous?
No, when I first started out though, she was on the cover of Fortune, and she was getting a lot of press in 2014, 2015 when I first started out. And a lot of people said to me, oh, you should meet this woman, but I never did. But a number of our investors and advisors have met her and know her quite well. It's interesting, none of the people who are part of Praava ever invested in her. So I never really looked up to her in that way. I just thought it was a different sector, and I was a little suspicious of the technology, but I didn't know enough about it, to be honest.
Okay. So now the more serious question, which is board selection. As you know, Theranos had one of the most distinguished boards, but they failed miserably. And how will you select? I mean, how do you go about selecting your board members? How do you vet them? And what are the checks on them? Thank you.
That's a really good question. So one of the big things about the Theranos board was there was nobody on the board who had any experience in healthcare. And so that's a mistake that we're not making. So we have two boards. We have a Bangladesh board and we have a Singapore board. So Dr. Samin sits on our Bangladesh board. We have the Bangladesh board reports into the Singapore board, but the Bangladesh board is more to protect the local business and to manage some of the local regulatory challenges that we face. The Singapore board is more to drive the strategic direction of the business. And so as we look to expansion, we look to appointing more people to the board who have that deep healthcare experience, certainly. Are we ready to move on to the next panel? All right.
We have one question from the chat attending virtually.
Mm-hmm.
From Aslam Sharir. Mm-hmm. In exchange for how much equity or at what valuation are you looking to raise the $15 million?
So I'm happy to have an offline conversation about that, but I can share that we're raising the current round at $60 million pre-money, 60. do we have more time for questions, or we have 2 minutes? Okay. Katie.
When you talk about the
Can you just wait for the mic, please? Thank you. Yeah.
Thank you so much. When you talk about the 4% market share, and I notice you mentioned marketing, which Praava has done so little marketing to get where you are today. How do you think about getting to 4%?
So I think, well, we have done very little marketing. We've started doing more, I would say, in the last year. We're pretty aggressive on digital marketing. I've recently done some informal surveys, and people say that Praava is the #1 brand they see when they are on Google, which I think is good. We really follow people around who, if they're in our target group. So I think becoming more aggressive on that, but also I think becoming more aggressive specifically on different service lines, not only on digital, but also on the in-person services, right? And so when we launch new centers, and this is something that models like One Medical and Oak Street and others in the US have also done, is setting up marketing teams for each center, right? To get to know the local community, to go out and really find out what their needs are and how we can support them. So it's both, I think, above the line and below the line marketing. I don't have more time, unfortunately. I think we do need to move on to the next panel. So I'm going to introduce the moderator, Dr. Rishika Fernandapol, and it's honestly extremely humbling and exciting for me to do that. If anyone read my first business plan, there are a few people here who did. He's all over it because he's the founder of Praava Health, which is the kind of this generation of value-based care in the United States. He built it up from scratch. And he's truly an inspiration to me, so we're incredibly honored to have him with us. He's an advisor and an investor in Praava as well. And his company was just acquired by One Medical, and he's now the Chief Innovation Officer there.
Great.
Thank you so much, Rishika. Thank you for being here.
Welcome. Could I get the rest of my in-person panel on the stage, please? So good morning, everyone, if you're here in the US, and good afternoon if you're in Europe, and good evening if you're in Asia. This is truly a sign of the times, right? And I think these sort of hybrid models are where we're going in the future. It is so wonderful to be here. As Silvana said, I had the pleasure 20 years ago of having the same insight she did, that the way we do healthcare really didn't work very well for consumers. It was centered around the needs of the providers and the health system and not the consumers. And like her, said we need to start from scratch. And we did so. And we, over about 17 years, built a really nice company that just got sold. And I think was able to really make a big difference in transformation. And I think it's so exciting that Silvana and the team are doing this in other countries, where, to be quite honest, the need's even bigger than it is here. I've known her for about a little over 5 years now. I look back and have been very impressed. So she asked me to moderate a panel just about some larger perspectives on this. We have an amazing panel. We only have about 25 minutes, and we've got 5 panelists. I thought what I'd do is briefly ask each of them one question and have them speak for about 3 minutes each, just to respond to it, and then we'll open it up for a few questions from both here and elsewhere. So I'll start with Dr. Akhtar, who was Chief Medical Officer of Praava. He's been a medical doctor with about 30 years of experience. So how is care at Praava different? You've been practicing for a long time in Bangladesh. How is it different for both the patients and for the providers, the physicians?
Thank you for that question, Rushika.
Yeah.
A pleasure to have you here with us. First of all, let me say that I started this journey 5+ years ago. And my background has been for 30+ years, having had an exposure in healthcare in different parts of the world, Europe, America, Asia. When I started working at Praava, the first thing that caught my eye was the relationship between the patient and the doctor was immensely different. The complaint was always, we don't get enough time with the doctors. The trust and confidence was never there. So it's important to build up a relationship with that. So that's the first thing I would say that is very different. And we've been able to sustain it for a long time. That empathy comes across very strongly, and that is why we have loyal patients. For the physician, I think initially when we started the journey, it was difficult for them because they had been used to having assistants with them, and they would sort of cater to the masses. So they would have 30, 40 people waiting in line, so they would rush it. Instead now, Praava had given the doctors a slot of 15 to 20 minutes per patient. So now you would have to listen to them. It started becoming so interesting that within a couple of months, the doctors wouldn't stop talking to the patients. Instead of 15 to 20 minutes, we were having doctors talking for 45 minutes. My God, the patients, instead of the immediate experience was good, but the waiting patients were getting, so we had to work around that. So that'll be the first thing that I would say has made a major difference. And people always tell us that this is one thing we like about Praava, the time they give, the empathy they show us. I'm proud to be part of it. I think during the pandemic, we got an opportunity to accelerate our growth. And in the 5 years journey that we have, we've learned a lot. And we are now at a stage where we can say the model of Praava is a very robust business model. And it's working very well in Bangladesh, especially in Dhaka, where our hub is. And it's time now to replicate it in the different parts of the country, because we have a population of 170 people, 70 million people. It's not easy to say that I will just cater to a selected group of people. I think everybody in the whole country deserves to get an opportunity.
Yeah, that's great. No, so thank you. And I think there's a lot of people come to me and they want to build these scalable models, but they don't do what Praava's done, which is take years. It literally takes years to actually do what you did. Is build the model, build the culture, build the processes.
Exactly.
Then and only then can you start replicating it. So I think that's exactly the right path. So next is Dr. Hussain, who's the Senior Lab Director at Praava. Was in Boston, my hometown, at Dana-Farber, and has run a lot of labs and actually has been really key to setting up the lab services, which is, Silvana mentioned, is a really key part of the business. So Dr. Hussain, why is having access to world-class lab services so important, both for the business but also for the patients in Bangladesh? It's amazing there are only 5 labs in the country.
Thank you,
Yeah.
Rishika. It's great to be able to say a few words for our audience here about what we are trying to do in Bangladesh, and Silvana has gone over most of the details. I joined with Silvana and left my very active lab in Boston to set up the lab in Dhaka. And I literally actually took measurements from my lab benches and stuff like that and tried to copy. And I think we ended up having a much better lab than our old lab in Boston. So it's important, like as Rishika asked, to have quality diagnostic services, because we have tried to espouse the cause of that the doctor is helpless if the test results are at fault. So we need to have accurate testing. And this has been something that has weighed on me, because I have family living in Bangladesh, and they have always said, you know, these tests, should we believe these tests or not? And a lot of it depends on this idea that we should bring in to Bangladesh the kind of services, the kind of testing, which is doable because the machines actually are the same. We brought in exactly the same machines that are at LabCorp or Quest and so on. And we didn't, or I actually literally arm twisted Silvana to spend the kind of money that had to go in to build a kind of lab. So we are very proud of the lab. And we are of the opinion that this is the first thing that we have to have before we go to the doctors and the patients and tell them to come to Praava. He said, you can trust our testing, and we will kind of provide the services that are lacking in Bangladesh, unfortunately. So if I can add to that, Rishika, I think because of my interest in cancer research for over 40 years, I tried to think like, why can't we do the kind of genomic testing in Bangladesh that was absolutely missing? So we brought in the tests that were a small part of those tests that are offered to bring personalized medicine. So no longer is, especially now we know in cancer therapy very well, that one size fits all is a wrong concept. One size does not fit all. So you need to have a patient who has, let's say, lung cancer, be told that you have a certain change in your lung cancer, which can be now targeted by a very specific medicine. And this is now the common practice. So I'm not going to, for lack of time, go into how like the whole human genome is known. And so a person, everything about the person, what kind of different kinds of therapies that even doctors would not even be thinking about can probably be used to get a composite picture of a specific patient's specific disease. Some of these things we have started. They were going outside the country, and thankfully, a lot of our people in Bangladesh, hospitals and diagnostic centers have picked up. And while we were the first to introduce molecular testing, now maybe a dozen facilities are doing that now. So what do we do? So we have initiated the idea of expanding the testing to hundreds of tests. And we just recently completed dialogue with a company has roots to India, but is based in Raleigh, North Carolina, the Newberg Center for Genomic Medicine. And we want to start rolling out hundreds of tests that will be targeting initially in cancer, but then in reproductive medicine and infectious diseases also.
Thank you. I mean, the two things just to highlight there. One is the notion of trust. I think that's so important to build a great business, right? Particularly a consumer business, is to have that people can trust the results, they can trust the physicians, they can trust what you give them, they can trust the medications, which is a huge problem in many parts of the world. And then the other piece, one of my mentors was Paul Farmer, who started Partners in Health, and one of my favorite quotes from him is that thinking that some lives are worth less than others is at the root of what's wrong with the world. And why can't people in Bangladesh get the same level of care with, there are these huge advances in the oncology field in personalized medicine, right? This sort of one size fits all does not work. It is very ineffective. And I think, why can't we do that in Bangladesh and other parts of the world? So I think this is exactly the right direction. So I'm going to next turn it to, just go on the video to Jeremy Lim, an old friend back in his Oliver Wyman days. So Jeremy, just to put this in a larger Asia-based context, there are things that Praava's doing with value-based care and some different payment models, and there are a few other companies in Asia trying to do this and seeming to grow. For instance, Indonesia. Just could you put this in a bit of a context and why you're excited about what Praava is doing?
Yeah, and a very good morning to everyone. Thank you, Ruchika, for the question. Maybe before I answer it directly, I'll just make a comment that I visited Praava back in February 2020. And my comment to Silvana was, it's too grand, right? You're gonna frighten away patients who think you are too expensive, right? And with the benefit of hindsight, it is the way to grow a business that will endure over generations. And I cannot overemphasize how important trust is. And particularly in low and middle income countries, and having lived in the US and in the UK, I think many citizens and residents of those countries take the trust and the quality for granted, without appreciating that counterfeit drugs and false investigations are just so commonplace in much of the developing world. And if we look at what everyone's doing across Asia, if you look at, say, Ayala Health in the Philippines, you look at Vinmec in Vietnam, MTech in Indonesia, everybody is working on some variant of the bricks and clicks model. Whether you start with bricks, a classical hospital group, they're all becoming digital in some form. And if one starts with clicks, the telemedicine providers are now acquiring clinics and trying to do what Praava, right from day one, had the insight at the steady state, whichever end that you reach it, that you start with, has to be an integrated model built on trust, empathy, respect, and dignity. So I'm very excited about the Praava model. I would say upfront, it's an expensive model to start with, but if you want an asset that as investors we can be proud of, we can tell our grandchildren that we were part of this story, then this is the only way to build quality healthcare over the generations.
Great, thank you very much. And I think you're right. I think this is, again, from personal experience, it took us 17 years to build what we built. These are not 1 and 2 year games. These are decades-long games that we're playing, but it's exactly what the world needs, right? And particularly in a place like Bangladesh with the rapidly growing middle class, et cetera. So I think this is, again, great investments, but you gotta have some time horizon. You can't, in 3 months, where's my money, right? But I think you're exactly right. It's the right way to do it. And it's very tempting to take shortcuts. We had plenty of people tell us take shortcuts and do something quicker. And it's like, no, we think the bigger return is actually by doing it the right way. So thank you. I next turn to Chinta Bhagat, who's a managing partner in Asia of L. Catterton, leading all their healthcare investments in Asia, as well as former McKinsey. So can you talk about why is this a good place to build models like this?
Again, building on some of the others, thank you for putting me, Silvan, putting me on the panel, and it's good to see so many friends. Patrick, Jeremy, and I go back a long way, both individually as well as group. And specifically to that question, why is this right? Look, unlike in most parts of the world, where health systems have had decades before, and where you can have the likes of companies coming in and sitting on the infrastructure that has been built already, where you can rely on that infrastructure to be able to disrupt, to actually use the D word, right? In most parts of Asia, that infrastructure never got developed. And in the last 20 years, wave after wave of this infrastructure, I don't mean by I mean hearts, people, all of it, right? Get developed after wave in rapid succession, like 2-decade type. And why it's been exciting for me personally, and I know both these part of this it's been the piece of hospital infrastructure getting built, diagnostic built, primary care getting built, and now vision infrastructure getting built, all in a very compressed time frame. And so everything that you've seen in kind of the US and other 4 or 5 decades has happened here in 10 15 years. Sometimes with very rapid overlapping models, the chaos with it. And I think personally what I was impressed with what Silvana is doing in Bangladesh is it's very in tune with where the infrastructure in the market is. Because there isn't a lot of this existing infrastructure right off. So she can't afford to, for example, do what like doing in India, which is simply write on relationships with diagnostics companies. None of it exists. You do a lot of it de novo. And I guess that's what Bangladesh and what Praava is doing is exciting. More challenging, but also exciting.
Great. Thank you. Right, I mean, this is a greenfield, as people call it. It's amazing what a greenfield this is. And again, if you can do it in Bangladesh, there are lots of other countries like Bangladesh that need this. I'm from Sri Lanka, and there is non-existent primary care, truly. Yep. And as chronic disease, in all these countries, all the Western ills of chronic disease, heart disease, lung disease, pick your poison, diabetes, are all happening. And what exists in most of these places are basically you go to the hospital and you wait all day for someone to spend 45 seconds with you. That is not primary care, and it's not great service, and it's not great outcomes. So I think there's a huge opportunity. So I'll next turn to our last panelist, Patrick Edelman, who's Managing Director at Code Advisors, a career healthcare person, formerly led BlackRock's healthcare investments, and is also a fellow member of the Global Advisory Council of Praava. So Patrick, why are you excited about this? Why is this, so this is clearly the right thing to do, right, for the people of Bangladesh, but why is this also a good investment?
So I'll go back, sorry, I don't know if you're getting a little bit of echo, it sounds like on my end. So I'll go back to what I saw maybe 20 plus years ago and what brought actually Chinta and I together ultimately, which was 20 plus years ago, I made a trip to Singapore to see a small company called Parkway Hospital. And I happened to be in the Regent just looking and did a meeting with Parkway. And if you're not familiar with Parkway, Parkway became something much, much bigger. It was the local provider within Singapore, as Jeremy well knows, and then through some, I guess, I want to call it infighting or some battle for an asset between a few large private equity firms and me sitting outside as an outsider, as a large shareholder, and not being able to be an activist, we saw it become IHH. And what I saw there was people will stop buying this. At some point, if discretionary income says, I don't have enough to do this, but if they have a greater quality of life, they see greater quality of care, if they see longevity, they're going to pay for that. So I've been to enough hospitals. I've been to Lipo Village in Jakarta and seen Glen Eagles on one side and Lipo Village on another. And I've seen a public and a private hospital and walked between them in a matter of 15 minutes and seen, just knowing that once I have that higher level of access to care, people will do that. I have a massive population in Asia. I have, as I think some of my other partners have said on the call, no real access to insurance, and so affordability is a big thing. So there's this multitude of kind of coincidences that are all kind of happening at the same time. But that access to care, that higher level of care, it's paramount. And I step back and I look at something like Bangladesh. And why I think the opportunity to play a site with Praava and Bangladesh is so big is the population is just massive. Like, it's inevitable. We've seen these charts thousands and thousands of times before, not thousands of times because there's not that many countries in the world. We've seen it about 270 times, right? But as GDP increases, healthcare expenditures increase exponentially. And so capitalizing on that, finding an opportunity, an operator like Savannah and the team that she's putting together, it just makes sense to me.
Great. No, thank you very much to all of you. We have about 5 minutes, I think, for a few questions. If there are any, we can do it. Do we get a humorous one too, along with the serious one?
I met Elizabeth several times, and I did not invest. I can say that.
Okay.
Okay. As we all know, because of the pandemic, there is a serious mental health crisis throughout the world. And Bangladesh particularly suffers from one of the lowest number of psychiatrists in the world per capita. How can Praava help on that front? Because that, I think, is a very, very serious problem, in addition to the physical ailments that you try to test about.
Great question. I think mental health is obviously biological, so the incidence is the same everywhere, and I think increasingly trying to integrate it in with physical health is the right thing. So do you want to take that question?
Sure. Thank you, Taryn, for that question. So mental health is a big issue, not only in Bangladesh, but globally, especially during the pandemic. For Praava, what we have done is we have in-house counselors. We've had them from the beginning, 5 years earlier when we started. So they are offering services to the staff in Praava. They are offering services to anybody who is willing to call and make an appointment. We're willing to do that. We've also partnered with some of the healthcare organizations who have counselors. So there are a few organizations who are doing very well. So we've partnered with them and we give free services there also. It's a question of being available at the right time, and those who can afford it will pay for it. Those who can't, fine. We have hotlines also. They will get the counseling through those sources also. And our family doctors, we pride ourselves in that all of them have been trained to a certain extent for basic mental health well-being sessions. So I think we are comfortable with that, but we are always alert to find out who is offering what so that we can upgrade ourselves.
Great, thank you. Yes, one more question? Any from the remote folks? No. All right, Silana?
Yeah, I don't know if my mic is on right now, but I just want to thank all of you, and Patrick, Jeremy, and Chinta. I wish you could be here with us today, but thank you so much for joining, especially those of you in Singapore. Really, really appreciate it, and hope to see you soon.
Thank you.
Thank you.
Thank you, Rishika.
Thank you.
Just going to move this out of the way because I couldn't see all of Rishika. Thank you, Yoham. Thanks. Do we have Dr. Ishrak with us? Okay, great. Good to see Jeremy, though. Does anyone have any other questions that you didn't get to ask in the last panel? I'm happy to. Oh, great. Hi, Dr. Ishrak.
Hello.
How are you? Good to see you. Good morning.
Yeah, I think I can hear a little echo. So how do I get that fixed?
We can hear you all right. It's an echo on your side?
Yeah, when I speak, it seems to echo back. Let me just mute myself. Not, or at least the speaker, take the speaker. Well, can you hear me now?
We can hear you, yes.
Yeah.
Is it still an echo for you?
Well, there's no echo when I put you on mute.
Okay, but then you...
So, that's okay.
Okay.
I'll be speaking and then I'll go on mute so I can hear you. So we'll just
Okay.
go back and forth.
Let me
Okay?
just introduce you briefly, although I think many people here know who you are. Dr. Omar Ishrak is a Bangladeshi American businessman. He's currently the chairman of the board for Intel, which is a role he's held for a little over 2 years' time. Prior to that, he was the chairman and CEO of Medtronic, and before that, he was the president and CEO of GE Healthcare. He has been a friend and mentor to me since the very beginning of my journey. I forced him to meet me in Washington, D.C. about 7 years ago, I think. He's an electrical engineer by training, and we're very lucky to count him as part of our team. He's going to make some keynote remarks today about what, some of the work that he's doing and how he thinks Praava's work fits into what's happening globally in healthcare. I'll let you take the stage. Dr. Ishrak, can just remind you that if you could let us know when you need the next slide to be shown. That would be great. Thank you.
Excellent. There we go. You can hear me okay, right?
We can hear you, yes.
Okay. Well, listen, I'm going to talk a little bit about healthcare in general, a little bit about how it applies to what I call underserved markets or emerging countries in general. And I'll weave in some comments about Praava. But these set of slides weren't really created just for Praava, they were created for healthcare in general. But at the end of this, I'd love to take some questions and have a short dialogue if that's helpful to everyone. So first, I just wanted to mention in fairly clear terms, that healthcare is a need across the world. And we talk a lot about value-based healthcare, but essentially value-based healthcare is simply what it means is that you get better outcomes at a lower cost and you create value in healthcare. And actually, this should be, as you get universal healthcare, if you really do have value-based healthcare in place, you actually get growth in economy. Because if the cost is lowered, you're getting more healthy people, you get reduced hospitalization costs, and you get a growth in economy. And so healthcare is a very important piece of the world, which is often overlooked as a side project. So with that, can I move to the next slide? Now, when we talk about technology in healthcare, the growth in technology, which I see very clearly in the consumer world, can actually be applied to healthcare in a pretty dramatic way. Here are three big things that can be applied, that technology can be applied to. First is to leverage the latest care guidelines at scale, and I'll come back to that because that's a very important point. What it essentially means is that you can homogenize the process of care, something that was previously, it still is taught, but something that was only could be delivered by completely trained physicians personally. Now you can lesser trained individuals with access to information through the cloud that gives them standards of care for taking care of patients who otherwise they would only have to refer. So that's one big, and I'll talk about potentially a game changer in healthcare. Second is using technology, ubiquitous technology that's becoming more and more apparent and more cheaper. I mean, 15 years ago, cell phones weren't available everywhere. Today they are. 15 years from now, there'll be new things that'll be available that aren't today. Can we use that to help healthcare? And third, because of all of this, you can prevent hospitalization. And through that, you can manage patients outside the hospital. So with that, can I move to the next slide? Now, this is a big point that I'd like to make, which is more of a sort of I'd hate to say visionary, but a conceptual or a goal-oriented page. In this, let me take you back to the cell phone indeed. And, before the year 2000 or in the 1990s, especially in emerging markets, I know in Bangladesh, getting a telephone was extremely difficult. You'd have to, go and line up somewhere, and it would take a year to get a phone line established to your house. And Bangladesh isn't an exception. I think it was the same in India. It was the same in many other developing countries, where just getting access to a phone line was very difficult, and most of the population didn't have access to phones. Well, about 15 years ago, 10 to 15 years ago, that changed. That changed through the introduction of the cell phone, but it wasn't just the phone itself. It was the wireless connectivity. People set up towers that allowed one to have access to each other through these towers and these links that were suddenly made available. And as you can all understand and appreciate, and I'm sure agree, that completely changed communication in the emerging world. Today, a farmer who perhaps almost certainly doesn't even speak English is still using a cell phone, even texting in their own way sometimes. And that was unimaginable 20 years ago, but it is so today. And I'll put out this thought that the usage of standardized guidelines in healthcare through the cloud can have the same impact to healthcare as a cell phone has had to individuals in their communication. In the years past, the way in which people were trained were through documents in schools. And it is impossible to keep these up to date on a day-to-day basis. So they were trained with whatever is available, and individuals are trained, and then they were deployed personally to different places around the world, countries and villages and so on, where they delivered care from that training, which they had gotten updated periodically, at best once a year, or maybe 6 months, something like that. Well, today, guidelines, which by the way are the same for a heart failure patient in Bangladesh versus a patient in the US. You've got heart failure with heart failure. Now, there are genetic differences, there are some other slight differences, but by and large, 95% of it is exactly the same or more. Is exactly the same. You have to still train in some fashion, but then you can draw the latest guidelines down from the cloud, or at least potentially you can. And you can get you can have access to updated guidelines, and you can have proper training. And you can therefore deliver care at a more ubiquitous level throughout different regions of the world. And if I take Praava as an example, and that is certainly not an extreme case because that's still in a city, but even there, for the doctors available to know what the latest guidelines are, it's much quicker today by use of a computer or something and download information than it was 20 years ago when people go for periodic training. And that model can then be extended to more rural places in the country and in other countries as well. So I do think that if this use of the cloud in the right way, the use of the guidelines in the right way, it can really be used to completely change dramatically the delivery of healthcare, particularly in the emerging world. Can I have the next slide? Let me spend a few minutes on healthcare, a little context on healthcare, because healthcare, the application of healthcare is quite different depending on who you see. And this is at least like 5 categories of patients. And you can see from the chart that the type of care that you provide to each of these categories is quite different. You've got wellness and prevention. You've got people with chronic disease, a wellness and and prevention. You may see a doctor once in a few years. Chronic disease, maybe you see every year. If you're acutely chronic, you need to be monitored more closely, maybe monthly, weekly, and so on. And in the latest technologies, maybe even in real time. If you are in a hospital, you're under complete care 24 hours a day because you've just had an episode. And then post-acute is sort of trending back towards the acute chronic stage, but still a little more frequent care. So you can see that the nature of the healthcare that's delivered is different according to the population you're talking about. Now, if I go to the next slide, please. What is also true is that the cost of healthcare is the highest. The more right you go to the chart. Well, the peak is in the hospital itself, and post-acute follows it. And wellness and prevention is the cheapest. So what one would like to do in a healthcare system is to keep as many people to the left of this chart as possible. The whole point of prevention is that you don't go to the right. And if you do your work right, you will stay to the left. If you stay to the left, you've just reduced the cost of healthcare, you've improved the economy, you made a better healthcare system, you've got more healthy people. Now, that doesn't mean that people won't go to the right, but it is important to understand that if a person's disease escalates, especially if it goes all the way to the hospital, it in fact is a failure of healthcare, of that country and that system. So if all you do is build hospitals, you're basically planning for failure. So instead, you've got to do the sorts of things that Praava is doing, which is much more on the left of the screen, where you're trying to do wellness prevention, and then you get people with chronic diseases, manage them so that they don't go to the next stage. And the sort of thought process of value-based healthcare in that context is to prevent escalation of disease. And that's the way they should be thinking about it. But in that way, and I'm not talking about the business model for Praava or anything like that, I'm just saying that the economy generates money. If the economy generates money, businesses will generate money, because those businesses are contributing to that economy growing. And I realize it isn't as black and white as that, but I think you get my point, that if the overall economy goes and the business contributes to that growth, that business can well create a fair business model through which that business can make money and grow rapidly. Now for the next slide. The next slide, please. Yeah. I'm just going to kind of state here some of the things where healthcare, a little more in depth than the guidelines, where technology can be applied. In the continuity of care, from remote monitoring of patients to remote care of patients, to in-hospital care. I talked about the patient-level data that should be made available, but also an accountability for outcomes is important. That's what value-based healthcare means. It means an accountability for an outcome. And in some way, I do want to put a little bit of a yellow flag on too much of a discussion around diagnostics. Of course, diagnostics are important, but if you're zeroing in on making money and creating a system that is successful because of diagnostics, that is not enough. Diagnostics does not change an outcome. Diagnostics gives you information through which an outcome can be changed. Some other action has to be taken for the outcome to be changed. And to the degree that companies like Praava, who are doing well in diagnostics for the right reason, can then have the follow-up from the diagnostics at an early stage and keep people away from hospital, that is the right measure. And so an overemphasis of diagnostics is actually wrong, but that doesn't mean it's not important. It's very important. But the critical factor to measure is what is the result of the diagnostics. And if you do that right, then that's when you'll create a successful business. And that's one I think I really want Praava to evolve more and more into. We're keeping people away from hospital, keeping people well, and the remote care of some sort, or periodic care of some sort, because of the accurate diagnostics, is where this company can scale to and make a real difference in Bangladesh. Now, the next slide, please. And then, all I'd say is that, and I've talked about this before, these are specific things that can be done, specific technologies that can be put in. Each one of these is not simple. And if you scale it, they all require a lot of work. And so investment in technology for Praava is important. A clear thought process around technology is important. All the way from data records to, monitoring data, to the guidelines that I talked about. And then you need people who are focused and have training, at least to manage the sorts of patients they're talking about, because you're not going to do this without people. I mean, I realize you got the cloud, you got all that other stuff, but in the end, you still need people who are trained, who can use the information in the cloud to interact with patients in the right way. And then can I have the next one, please? Next slide. And all I want to say is that here, again, a little more specifics about the sorts of technologies that can be used. Remote monitoring is important. Stratifying patients is important, which I talked about, whether they're whether it's prevention or chronic or acute chronic and so on. Use the guidelines like I talked about and I've repeated many times. And then through that, you're going to improve the type of care, you're going to reduce cost, and that's what value-based healthcare is all about. And I do think that Praava is well positioned to make a move in this direction. I think Silvana and her team have the right thought process around it, and they're beginning to execute, but you have to execute a lot more. There's a long journey ahead. It's still very small, and the population is big, the opportunity is big. And by doing that, you can create a successful business and equally, if not more importantly, change the lives of patients, certainly in Bangladesh, and then over time in other countries as well, and through that make a real contribution. So with that, I hope I have a few minutes left to take a few questions. If not, I'll have to call it a close. So Silvana,
Thank
will
you.
be back to you.
Thank you so much, Dr. Ishrak. We definitely have a little time if you do. So that was really inspiring, I have to say. I always love that mantra that hospitalization is a failure of outpatient care. I think that's really what we believe at Praava as well. Dr. Rana Qureshi?
Hi, Dr. Ishrak. I had a general question, which is when you are able to leapfrog in a country like Bangladesh, because you're establishing a new healthcare system without all of the embedded issues of the old system, what do you think might be some of the learnings that might be actually translatable into, the West or into the United States from those kind of activities?
Well, I think it's what I've been sort of mentioning a little bit. I think the connection to outcomes. See, most of the developed countries, almost all, which have established healthcare system, have built a fee-for-service model. And a fee-for-service model essentially says that I do as many diagnostics as I can because I get paid for it, and I couldn't care less what happens once I've diagnosed somebody. Mm-hmm. And it seems a little sort of trivial to talk about it like that, but if you really look at healthcare systems around the world, they're built that way because that's all that was available historically. Bangladesh is starting it from scratch. I think a constant recognition and a line of sight to an outcome improvement, a measurement of that outcome improvement in a regular process can really leapfrog other countries. This is much easier said than done.
One of the
this
challenges.
Is something that I think companies like Praava, who are starting from scratch, can maybe take the lead in this focus on outcomes.
One of our challenges is data, right? I think because we don't have a third-party payer, there's no single payer, third-party payer. So the data we get is within our Praava system, and if patients self-report, which they often do. They often do bring us their records from when they've been hospitalized or somewhere else, but there's no guarantee of that. So that is definitely one of the challenges.
But you could also provide the data yourself. I mean, you could generally, what you have to do is to create a system through which you start to collect that data. I understand you don't have the interoperability of the hospitals and so on, but at least start with what you have.
Right,
because
absolutely.
When the first come in, create what you have, and then know what the gaps are. And over time, when you get a little more scale, the hospitals will listen and they will start to integrate. But build your own model and then go from there. Absolutely. And by the way, even in the US, interoperability isn't just, that's still required. It's just more often, but it still requires work.
Oh no, we've all tried to get our records from one system to another. It's very challenging. One last quick question. Tarin Bhai, please go ahead. I know you also, I think we're classmates with Dr.
Hi,
Ishrak.
Omar. Can you hear me?
Sure.
Okay. By the way, Omar and myself, we were classmates in Islamabad in 1971 and basketball buddies. So greetings from New York. My question is regarding medical devices. You were the CEO of Medtronic and before that, president of GE Healthcare. As you know, the pricing of medical devices is extremely high. How does a country like Bangladesh face this high cost? Because, whether it's diabetes clinics or, stents, everything is so pricey for Bangladeshis. I recently had our Dorji, the tailor, go through 3 stents, and it was 250,000 Bangladeshi taka. And he had to basically fund through all those who, use his services. So it's a very challenging issue for the lower middle class and the poor, which is the most of Bangladesh.
Thank you.
Yeah. Well, I get that question quite a bit, and there's no magic answer, but there's some magic principles. And one of the principles is that there are plenty of people, though, even in Bangladesh, who can actually afford the care. There are many who can pay out of pocket and afford the care. They're going overseas. They're doing all kinds of other things. Scale that. Find all the people who can afford care. I bet you the penetration, if you take just the number of people who can pay out of pocket and who need cardiac care, and you find out how many of them are actually getting that care, I can guarantee it'll be less than 15% or 20%. So just scale first. Have a way of scaling the care to people who can afford it. Now, what does that do? It doesn't help your Durji and all these people, but what it does is that scale gives you a cost benefit through which you can then reduce the cost, because the scale gives you a cost benefit. Because if you sell lots, the fixed cost percentage gets lower, and through that, the overall cost gets lower. And that's the way eventually in countries like this, you can work your way down. So that's one answer, and that's the more systemic answer. Agreed, that cannot be done overnight. The only other answer I have is that central authority, like the government and so on, has to come into this. But again, using value-based principles to the degree that they can, start to work rural care, start to work the truly underserved. And there's things that can be done there too, where corporations and others can help. But simply by lowering the price in general actually doesn't achieve anything, because you'll get lower quality. The people who really want it actually won't buy it. And they'll go abroad and get it, or get imported stuff or whatever, more expensive things. And the thing that you've priced lower won't even sell, because you can't, unless you give it completely for free, which is not sustainable. So I think there is a balance here. On one side, sell what you can, get maximum penetration, you'll get scale. Second, work the underserved through government agencies, through nonprofits, but be very careful that you don't draw the line there too high, and people who can actually afford it just jump into your free bandwagon. And so, I mean, this is not that simple to do, but those are two pieces of, suggestions that I would make.
Thank you so much, Dr. Ishrak. I'm afraid we do have to move on. I wish you were here with us and could meet all the wonderful people here today, but really grateful that you're able to join us from London, and hope to see you soon. Thank you so much for your time.
Thanks a lot. Thank you all.
So our next panel is going to be moderated by Carrie Breen, who has been working in private equity in Bangladesh for more than 7 years. Before I hand it over to her, unfortunately, all of the panelists for this are going to be virtual. I did want to just share a little bit about how I think of Praava as an impact investment. I think that Dr. Ishrak's comments actually were very appropriate, because I think that any patient that we're able to serve with high quality healthcare immediately is an impact. And so the 350,000 plus patients that we've served are already an impact. Could I see the next slide, please? It's well established that there are more people across low and middle income countries dying due to lack of access to quality care than lack of access alone. One of our advisors often jokes that, in Bangladesh, you can't walk 5 steps without tripping over an NGO trying to give you some services. But that doesn't mean that the doctor treating you knows what they're doing, or that the labs are being done properly, or that the drugs are not counterfeit, right? McKinsey also estimates that for every dollar that you invest in emerging market healthcare, you generate $4 of value in GDP. So investments in Praava to date have generated more than 50 million in value. I'll hand it over to Carrie now. We have some wonderful panelists from Harvard Business School and MIT Sloan, who are also longtime friends of Praava, with us today as well.
Thank you, Silvana. Thank you very much for providing that interesting context about healthcare and impact in Bangladesh. Hello, everyone. My name is Carrie Breen. I'm an advisor to Praava. I'm based in Bangladesh. I've been here for more than 7 years working in private equity. I'd like to introduce our panelists, and I'll just ask if they're visible on the screen as well, because I can't tell from my location. Are we?
Can someone say, yes, they are, yeah.
Okay, great. So we're very lucky today to have joining us 2 people who have deep expertise in the area of impact investment. I'd like to welcome Geeta Rao. Geeta is a senior lecturer at the MIT Sloan School of Management, where she's also the associate faculty director of the Masters of Finance program. Her areas of expertise are numerous, but just to mention a few, they include quantitative equity research and portfolio management, and ESG and social impact investing, among others. Also with us today is Michael Chu. Michael is a professor at Harvard Business School. He is also a longtime private equity investor in emerging markets. He co-founded 2 firms and participated in the creation of the modern microfinance model. Earlier in his career, he was part of KKR during the golden age of leveraged buyouts, which could probably be a breakout in itself. I also wanted to mention that in addition to being subject matter experts, both of our panelists have a deep knowledge about Praava. Michael has written a case study on Praava Health, which he teaches to his students at Harvard Business School. And for the last several years, Geeta has had students from her Masters of Finance course work with Praava on projects, including valuation projects and around impact measurement. So thank you both very much for joining us here today, and welcome to our conversation. So we're here to discuss Praava as an impact investment, but first I wanted to take a step back and talk about impact investment more broadly, because I think impact investment is in the eye of the beholder today. We all see it differently, we define it differently, and think about it and even measure it differently. So I'd like to start off by asking you how you define impact investment. Perhaps, Michael, you could start us off with your view on that.
Sure, it's a pleasure to be with you all. In the last decade, impact investing has become very popular, but with its popularity, it's come to mean different things to different people. And I prefer myself a very precise definition. And for me, impact investing consists of 4 elements. So impact investing is first, the practice of investing. Secondly, in companies that have at its core seeking measurable and meaningful impact on a defined social issue. And thirdly, prior to the coming in of capital market entities. And fourthly, seeking a commercial return.
Great. I mean, that's a very stringent set of criteria, actually, and might, in terms of the impact world, perhaps would be a small portion of what people might self-identify as impact investment. But Rita, over to you. How do you kind of reflect on that definition that Michael's provided, and what would be your own definition of impact investment?
Thanks, Carrie. It's really a pleasure to be here with you all today. And as you mentioned, as Michael mentioned, impact can be in the eye of the beholder, which is both good and bad. We need a more consistent set of definitions for what impact is. But I think consonant with what Michael said, I see impact as, when you have successful impact investing, impact is organically incorporated into the business model. I'm first and foremost a finance person. I've been an investor my entire career. So, it has to be there right from the start for it to be meaningful, not bolted on, which is what we are seeing a lot of these days. And it can really fall into the impact washing category. The second thing is there should be additionality. That is, this is a set of services or a product that is being provided that would not otherwise have had capital allocated to it. And that's really important. That's a really important definition, because otherwise there's misallocation or inefficient allocation of capital. And finally, what I would say is, we can measure returns precisely. Impact is harder to measure, but impact measurement is important. Again, in part because we are looking to blend a finance return and an impact return. We want to blend those two things. That's what the investor is looking for.
Mm-hmm. So, I think that's a really helpful framework for us to think about, having this impact embedded in the business, the capital being additional, and in both of your cases, you defined it slightly differently, but prior to capital markets investment or additional to what otherwise would get funded. I think probably in our kind of speaking to many people, we have seen that the definition varies greatly, and they struggle sometimes to apply their definition to Praava. So if we turn now in the context that you've provided in your opening, answers there to Praava as an impact investment, maybe Geeta, how would you see Praava as an impact investment?
Sorry, I was muted. This is our Zoom world. Yeah, that's a good question. I've had the unique opportunity to look at Praava in many different ways. For the last 3 or 4 years, we have had in one of my courses, Finance Lab, that I teach at MIT Sloan, an action learning course. We've had groups of students work very closely with Praava for just to do a deep dive into Praava's business model, financials, do evaluation, as well as impact assessment. So what I would say is based on that, and these are students who we have academic standards and academic integrity, so they're taking an outsider's look at it, and obviously I'm with them, teaching them. What is the additionality as far as Praava is concerned? You have a large group of people that are not able to get access to good, high quality healthcare. And that has, as Silvana pointed out, that has very profound effects, both immediate and long term. There's a large group of people like this. So that's one, that's the additionality. The second is, how is it being organically incorporated into the business model? And for that, I would turn to Silvana as a founder, has from the start emphasized what the journey of this company has been and what it's going to be. What are her role models? It is she could have chosen something else, but she's chosen primary care, which is hard to do, and in a developing country. And she's chosen to build a business model that is based on treating patients with dignity and providing them with high quality services at a reasonable price. And so it's really incorporated into that. And impact measurement, we've done a lot of impact measurement for Praava. Happy to share it with any investors or other people who are interested. Looked at it many different ways. And so I don't want to go into those details, but really looked at theory of change, looked at the whole life cycle kind of thing. So I'll hand it over now to Michael.
Sure. Carrie, you mentioned that my definition of impact investing was stricter than most. And I think that's important because why invent a new term if it doesn't separate it from conventional investing? For me, Praava fits all of my 4 elements. To begin with, healthcare and access to healthcare is fundamental for somebody to reach one's potential. And it's well documented that a healthy population is one of the driving engines of economic development. Praava is aiming to bring accessible healthcare, effective and customer-centric, to the majority of Bangladeshis. And Silvana seeks not only commercial returns, but outstanding returns, so that she can scale the model to the degree that the problem itself requires. And of course, the greatest impact is investing in Praava now, not 3-4 years from now when there's 3 or 4 years of profitability proven already, because then investors are going to be lining up to put their money into this model, just like in any other investment. So the point of impact is actually investing in Praava right now.
I think that's a great comment, the timing. And, once things are certain, then it's easy for people to kind of join and say, great, and this is a sector in a country that has tremendous economic potential because of the lack of supply. So for purely commercial investors, it's got the return they're looking for. But earlier stage, as you say, is when the impact investors can really make a difference. I mean, Silvana and I have talked to many, many different impact investors. And one of the themes that comes through in our conversation with them, a number of them are focused on the bottom of the pyramid. And they want to invest in companies that are directly serving the bottom of the pyramid. As we know, Praava's target market is the middle class, although it has patients from all walks of life, the way, Silvana's defined the value proposition, and the problem that Praava is solving is the focus on the middle class. So, I'd also like to ask you, is Praava relevant for these investors? And what is Praava's impact for the bottom of the pyramid, if you think it does have that impact?
Well,
Michael, maybe.
sure.
Yeah, staying.
Carrie, I think it's natural for our hearts to be more open when we think about the bottom of the pyramid. But we shouldn't let that mislead us into forgetting that the majority of people are actually that 50, 60, 70% that live below the well-served 15 to 20%. And that is the majority of Bangladeshis. And to have effective healthcare is key for that majority of Bangladeshis to live closer to their potential. And actually, all the decades of my experience in investing and thinking about the base of the pyramid is that it is much easier to build economic viability by serving the base of the pyramid. And that itself makes it easier to get to the bottom of the pyramid. Because once you build economic viability, then going lower is a matter of marginal cost.
So in a way, the most sustainable approach to actually providing healthcare that reaches even the bottom of the pyramid is to have a business that has the economics that's maintaining it, and then its services can be offered additionally to that lower income segment.
Yes, I understand totally the temptation of people seeking impact to start with the lowest 10%. But in a sense, for me, that's sort of saying, I'm going to learn how to mountain climb, but I'll start with Mount Everest first.
Right. Much harder to build a business that's sustainable and scalable based on that consumer base in a way.
Often impossible.
Yeah. Often impossible. Geeta, what are your thoughts on that in the bottom of the pyramid question?
You know, I think as investors, we think about risk and return, right? Now, and when you're talking about impact and you're talking about the base of the pyramid as opposed to the bottom of the pyramid, at the bottom of the pyramid, yes, you can have business models that will have a lot more risk in them. So are you hearing an echo? I am. You're not?
I'm not, no.
So at the bottom of the pyramid, you've got a lot more risk. You've got the potential of return, but to achieve that sort of not trickle down, but flow down, hopefully, you have to prove the business model, have it work, have it be established, and then you can expand down. The second thing I would say is I myself grew up in India. I'm from a poor country. There is an enormous multiplier of health, economic multiplier of health. When we serve the base of the pyramid, you look at chronic diseases like diabetes, high blood pressure. They're affecting hundreds of millions of people who are in their 30s and 40s. It reduces lifespan. It increases, it reduces the income generation potential of middle-class households. Now, these households in turn are consumers, and they support the bottom of the pyramid. So you will have a person, a middle-class person, and they will have a cook or somebody who comes in to cook. They'll have somebody that may drive for them. They'll have somebody who, delivers food for them. There's a whole informal economy at the bottom of the pyramid that is supported by the people above them. So this is not a competition. This is actually, it is an inclusion story here.
No, it's interesting. I wonder if do you see a trend of more investment funds kind of adopting that approach? Because, and I'm not an expert in impact investing, but I do see this significant bottom of the pyramid theme. And I wonder if there's a movement towards this broader definition of what impact can be in terms of where you play in the economy. Geeta, I don't know.
You're asking me? Well, I think, it's a complicated question. I'm sorry, I don't mean to dodge it, but it's complicated because the needs of bottom of the pyramid consumers are the same as those of base of the pyramid consumers. But the reality is providing those services, those products at scale can be much, much harder at that scale that it's needed to have a transformational effect. And you may need blended finance. And that is one thing we are seeing, whether it is, foundations, endowments, and even, multilaterals partnering with private companies or other organizations with NGOs to provide those services. You need a de-risking of the business model in order to be able to effectively serve them.
Interesting. Interject. I think maybe we only have a few minutes left, and so it'd be good if we could shift to questions. I will just make a point that I recently, a development finance institution told me that Praava was too early stage, but that they would invest if we had 3 years of net profit, which I found shocking. If I had 3 years of net profit, I would reinvest in my business. I mean, anyway, but so I do think that although I love this discussion. I mean, everything that has been said resonates with me, but I'm not sure that large groups of investors are necessarily thinking that way yet, but hopefully they will all glean from your wisdom. I think we have time for 1 or 2 questions, which I'll field, and then Carrie, you can direct. Do we have a question from the virtual audience?
We had a question that came in earlier. For Professor Chu, you actually did a case study of Praava at Harvard. Was curious what kind of feedback the students had and how that went.
Sure. The Praava case was a hit in my course on business at the base of the pyramid. First of all, the students were taken by the importance of the matter that was being tackled. And like many of us, the students were really impressed by the commitment and the passion and the talent of Silvana. Secondly, it was really interesting because it was a click and brick model, which is a no-no for venture capitalists that have been trained and worked in the sophisticated capital markets of the US and Europe. But arguably, a click and brick model may be more suitable for the local circumstances of Bangladesh. And finally, Praava, with its difficulties in fundraising, provided an opportunity for us to talk about other possibilities of making that fundraising easier. So it was a really rich and fun and engaged class discussion.
I think we have time for 1 more question. Oh, we're out of time. I'm so sorry. Thank you so much. I wish you could be here with us. Professor Rao, I know you have a family wedding coming up. All the best for that. And we hope to see you in person in Dhaka very soon. Thank you so much. Thank you for moderating also, Carrie. So I know a lot of people, I find in my pitches that 20 to 30% of my pitches often ends up being educating foreign investors on the Bangladesh market. So we wanted to take the time to have a panel discussion on Bangladesh as an investment opportunity. I'd like to introduce the moderator, Faisal Gori, who is a friend and has been investing in public markets across emerging markets for many years, and specifically in Bangladesh. Faisal, please join us. He's here from Florida today. Happy to have you here with us. Thank you.
And is Jamie?
Yeah, sure. Yeah. I think you can introduce him. And
sure. And is Sonia joining us virtually, or is she?
Sonia and Kamal are online, right?
Yes, we are.
I guess we can just.
Great to have you with us.
Oh, yeah.
Great. Yeah.
Right.
Perfect.
Thank you so much for joining.
All right. Okay, I can see them. So yeah, let me begin by making some introductions. Jamie is a portfolio manager at Sandglass Capital with considerable experience investing in frontier and emerging markets. Sonia Kabir is one of the leading venture capitalists in Bangladesh and an investor in Praava. And Kamal is the CEO and founder of one of the largest fintech mobile payments companies in Bangladesh called bKash. And we can get started with Jamie. So Jamie, please share with us kind of what makes Bangladesh an exciting, interesting investment opportunity within frontier emerging markets today.
Sure. Thanks, Faisal. Really appreciate it. It's great to be here. First, I feel with Sonia and Kamal on this panel like a bit of an imposter because they really have deep on-the-ground knowledge of investing in Bangladesh. My first visit to the country was in 1994 when I was in high school. I was living in Kathmandu, Nepal, and we would go from time to time to Bangladesh for various sort of arts and sports events. And so to have seen the change that country has experienced since then is really truly remarkable. I started investing in Bangladesh in 2008, and just to level set, we only invest in publicly traded equities. So unlike a lot of the other investors that are here or that are speaking, we don't do venture capital, we don't do private equity. I think that there are three things that really jump out at me when I think about the opportunity set in Bangladesh. The first is the strong and consistent growth that the country has been able to achieve over a long period of time. So despite all of the headwinds that I think a lot of us have in mind when we think about Bangladesh, natural disasters, political instability, regional issues, commodity price dynamics, when you look at how well the country has been able to navigate those challenges and continue to deliver 6, 7, 8, 9% GDP growth, it's pretty remarkable. And it tells you that there's an underlying growth engine driven by demographics, but also driven by reform and infrastructure that I think have stood the country in good stead and will continue to drive that growth going forward. The country now has a GDP per capita, I think this was referenced earlier, of about $2,500, which puts it really at the very beginning of what we believe is sort of a J curve of consumption growth. You see that the consumption of white goods, of automobiles, of two-wheelers really begins to grow. And so we believe that there's an emerging consumer story here that really fits very well into the Praava narrative that's very powerful. The second thing I'll say is that the infrastructure investment, which when I was there in 1994 was practically non-existent, has really been transformational, and I think is at the beginning of a next phase of investment. So I think the country is more or less 100% electrified. That's very different from what it was 5 or 10 years ago. You've got big investments like the Padma Bridge, you've got highways, you've got rail networks, you've got a Dhaka metro rail that are going in, you've got special economic zones. And when in a country as densely populated as Bangladesh, each of these investments has a really outsized impact on growth and profitability. I think that's something that's really lost on a lot of folks. You can build a bridge in Iowa that has 10 people that cross it every day. It's not really going to make that big of a difference. When you do that kind of investment in Bangladesh, it really does. And then the last thing that I'll say is that the public equities market is still very nascent and still very inefficient. So there are only about 20 companies that trade more than $1 million per day, which makes them sort of institutionally viable. Of those, there are probably only 10 that I think for foreign investors really make sense because of corporate governance and other dynamics. There's a lot of inefficiency, and I think as a portfolio manager, that provides a lot of opportunity. The asset management sector in Bangladesh in aggregate is significantly smaller than the largest Pakistani asset manager, single asset manager. So there's a lot of room for development, for the development of products like mutual funds that I think will increase liquidity and increase participation by retail and institutional investors.
Thank you, Jamie. Sonia, turning it over to you, kind of as a venture capitalist, what today are some of the more exciting opportunities? Which sectors are you focused on? And given kind of what Jamie kind of alluded to in terms of population density, which types of companies do you think that population density lends itself to as building better companies?
Thank you. Jumping right on to your question, very interesting times for Bangladesh. I've been living in the country for the last 14 years, and I've seen the growth and the momentum that has happened. It took a little while for us to pick up speed, but what we're seeing right now is the consumption of services through digital technology is rising. And I'm sure Kamal will be covering a lot on fintech, so I don't want to steal his thunder, but we're seeing that health tech, edutech, agri-tech, and then logistics and e-commerce. These are the upcoming sectors where people will be able to solve the problems of the citizens who are, who are waiting to be served digitally, and where the investors are looking for some kind of a transformative impact. So Bangladesh seems to be ready at that, with the mobile consumption, with the internet penetration, with the digital literacy that has happened. We are now digitally ready. These were phases that happened in Bangladesh, right? First, it was just the digital literacy that took a little bit of time, and then getting the skills and of people to use technology. And now we're seeing that with COVID, the digital transformation that was happening, the acceleration of digital transformation nationwide, got people more ready to consume more technology. And so besides fintech, I would really reiterate that it's edutech. Health tech is a very, very big sector for Bangladesh. We feel that this is just poised for a super duper takeoff. We see that it will be hyperscaling very quickly because the needs of the citizens need to be addressed. We have a shortage of doctors, so that's why leveraging technology to give those services is going to give us a lot of benefit. And then agri-tech, e-commerce, and also logistics. These are areas that would be very, very interesting for VCs to look at Bangladesh.
Thank you. Kamal, question to you. It seems, kind of over the last number of years, there's been, no shortage of money going into places like India, and over the last 2 years, even in Pakistan, both from kind of foreign investors. You've successfully raised from, SoftBank, the IFC, the Bill and Melinda Gates Foundation. I mean, what advice would you have to kind of entrepreneurs trying to raise today, and why do you think Bangladesh has been overlooked? So I think you may be on mute, Kamal.
Thanks. Sorry, sorry for helping me. Didn't notice that it was on mute. I wouldn't say we are completely overlooked. I mean, if we are overlooked, then we wouldn't be able to do what we are doing in Bangladesh right now. And we can talk about many different segments. It's just not the fintech and venture capital fund. And you mentioned about Pakistan, but if you look at the FDI that went to Pakistan in 2021, Bangladesh isn't that behind. I mean, when you compare that with India, then it's a different game altogether. But Pakistan, I don't think it's not a very good comparable number. I mean, love to see the numbers. But in general, I would say, how do you attract fund? My apology, it's my kids. It's if you build a textbook company, that is great to achieve from Bangladesh. And if you look at the fundamentally, last 50 years, what we have achieved, within first 4 years, Bangladesh achieved a good constitution. We achieved planning commission. We achieved central bank company act. We achieved a very functional central bank. Many of these things, countries, when they're born through, brutal independence war, many countries have difficult to resolve this thing even 20, 30 years later. Okay, so the foundation was very good from the day one. Okay, then subsequently we had few years of military dictatorship and all the other things, but then if you look at last 30 years. It has been consistent growth, and then definitely last 12, 13 years, a very predictable growth that we are seeing, and private sectors are taking are encouraged to take responsibility. And if you see that even government institutions are engaging private sector to make sure that their services are done effectively. And of course, there are other forces that also encouraged to build the country and complement the country's growth. Okay, in the 80s, NGO played a very important role, and then subsequently, when the private sector took over RMG, that played a very effective role in the country's growth. It brought the woman out from home to work. So if you look at all this phenomena, this is a very predictable growth that we're having. It's not like back in 80s or 90s when there's a liberal magazine would be quoting somewhere that there will be next Asian tiger, Bangladesh will get very excited. But I don't think that's not the phase we're going through right now. And And certain things, if it doesn't work, but you see something else is working. So it's basically very much it's the overall bottom-up rise that is taking place due to if you look at the macroeconomic numbers, the reserve is very solid. If you look at the consistent supply of foreign currency to Bangladesh, whether from foreign remittance, from the migrant worker, or from the export earning, is very, very solid and very predictable. And on top of that, the child mortality, people remaining healthy, and that's giving different kind of confidence to people that we can aspire to do something else. These phenomena is fundamentally making a very positive impact in the country. And if you're talking about FDI is coming. I mean, you know, our existence, Bikash's existence, the company that I am working for, our existence and the way we have attracted fund, that also demonstrates the character of the company. We didn't just raise hundreds of millions of dollars and then squandered around. It was a very, how do I say, cheeseburger eating entrepreneurs approach. Our initial fundraising was only $5 million, okay? But that has moved to a totally different scale when we generated the result, okay? So I think that's what we need to keep in mind, that if we do generate the result, if we remain focused on building textbook company, there are good institutions in the country to support this kind of growth, whether it's central bank, Ministry of Finance, exporting, you know, the Board of Investment. All these institutions are there to encourage investors to come in and find the right kind of investment for them. I mean, if we say we want to build aeroplane in Bangladesh right now, that's not the right fit. But if we are building, if you're investing in technology that reaches millions of people, Bangladesh is the right place to invest because of the overall digitalization that has taken place in last decade and in a broader sense, almost last 25 years since mobile phone came to Bangladesh. So I'll stop here.
No, thank you for that. Let me just ask kind of one follow-up. I mean, kind of one of the things that we've also seen both in the developed world and the developing world is, you know, successful founders incubating or helping kind of seed kind of additional startups. Are there companies that you are an investor in yourself that you may want to talk about, or specific sectors within Bangladesh that you're excited about, and whether it's fintech or mobile payments related or otherwise?
I'm not. My heart, my entire time, my mind, everything is focused on Bikash, and I believe there's so much to do. And I don't even have a Facebook account. I mean, I just don't have the time to do Facebook. So I remain very focused to do what I do, single-mindedly. Anything to do with digital adoption, because I think the beauty of digital technology is that whatever is being done in Boston today can be transmitted to Bangladesh tomorrow. Okay, and you know, in a very fundamental way, brain power is democratically distributed, and we have plenty of brain powers in Bangladesh. Okay, so therefore, whatever any technology or adoption of technology, whether to export or for internal consumption, that requires people's mass adoption, Bangladesh is a very good place to deploy, and whether it's mobile phone or the digital money, that's something that I'm working on, are very good initiatives for us to deploy. But what I want to also emphasize that, see, because we have a digital foundation very strong, 98% of the country's population have access to, geography has access to telecom infrastructure, and probably by now it's 100% almost. The country has 100% electricity access, the entire country, okay? 120 million or more handsets are available to a population of 170 million, okay? So when you have this kind of data, digital technologies adoption can be excelled very, very fast. So I would say ideas that capitalizes this inherent advantages Bangladesh have should be doing very well here.
Thank you. Do we have any questions from the audience? Sure, we'll go to you, ma'am.
Jamie, I'm curious, you had mentioned the J curve of hitting the $2,500 per annum income and what you anticipate in terms of consumer markets and what that brings. What, if any, is that relationship to the capital available in the markets where you just had mentioned there's maybe 5 institutions that you think are available or are appropriate for international investment, that kind of thing. Is there a relationship between that consumer base and what the broader market will support?
So I think that this is something that's evolving literally as we speak. That is to say that, that I think on the radars of investors like us who look at publicly traded equities, there are companies like Singer, there are companies like Marico, Bangladesh, there are companies like Walton that are probably very well positioned to continue to serve and grow with these markets. They're introducing new products, they're forming partnerships with Japanese and Korean and Turkish suppliers so that they can kind of bring that best technology, an appropriate technology for the Bangladesh market. The nice thing about all of these companies is that they are typically very free cash flow generative and under-levered, so that they can fund their own growth as well. And I think that's really important in the context of a country that is relatively capital constrained. One of the challenges in Bangladesh is that the banking sector is in very difficult shape. There are some very excellent banks, but in general, there is a problem of under-provisioning and relatively high levels of NPLs. That means that capital availability for more mature businesses is there, but it tends to be quite expensive. And so I think the ability to kind of match that supply and demand from a capital perspective is evolving, but it's not quite there. And I think the last thing I'll say is that I think there is a question of price discovery that still needs to mature in Bangladesh. So you take Bcash, for example. It happens to be, and I'll make this quite quick, we can talk about it later afterwards, but they received an investment from SoftBank at about a $2 billion valuation. Congratulations, Kamal. That means that BRAC Bank, which owns about 38% of the company, their valuation, or the value of that investment is about $750–800 million. The market cap of BRAC Bank today is $800 million. That is to say, you're getting either, and it has a book value of about $700 million. So you're either getting Bcash or the bank for free. And I think because Bcash is by design not profitable because they are investing so much in growth, that value is not yet being properly reflected in the share price. Eventually that will happen. But it is to say that there's still this disconnect that I think will that needs to evolve.
Thank you, Jamie. Do we have any questions from our virtual audience? If not, then sir.
When I was in Dhaka a few years ago, capital controls were a concern to foreign investors. Easy to get the money in, harder to get it out. Has that situation evolved to the point that more foreign direct investment feels comfortable putting cash into Bangladesh?
Jim, you want to take that one?
Sure, I'll keep it short. So certainly capital controls are no longer a concern in the abstract, i.e. Because of the very sort of solid fundamentals of the country's balance sheet, there's no issue getting the capital out. What I will say is that the regulatory and policy environment is still quite capricious and sometimes short-sighted. And so what you do see is policymakers coming in and making regulatory decisions that can impact sort of foreign confidence. They'll freeze the stock exchange for some period of time, which they did in March. They'll put on volatility containment mechanisms that really reduce the ability to kind of trade effectively. They've introduced rate caps into the banking system, which is counterproductive in our view. So there are things that they do that make it, I think, make it more difficult for investors to get confidence in sort of their visibility into kind of like the policy environment. I think that's a more important issue or more important consideration than kind of pure capital controls.
Can I just add a point to that? I will say for Praava, that's less of an issue because our shareholding is in Singapore. So any significant change of control or exit would happen at that level. But we can go into more details of that offline. But I just wanted to thank all of you, especially Kamal Bhai and Sonyapa. I really want to thank you for being here. I know it's really late in Bangladesh, but it's really wonderful to have your perspectives. I know that we all benefited from it. Thank you so much, and hope to see you soon.
Thank you.
Thanks.
Thank you, guys. So next, we're going to hear a little bit more about what Praava is doing in terms of technology. So I would like to introduce you to Keith DeElwes, who's Praava's Chief Technology Officer. Keith is a technologist by training and actually has a really interesting journey to Praava, which he shared a little bit in the video. He was a patient and then sought out an introduction to me and became an advisor and then ended up joining us full time, which is the journey of many members of our management team, actually. Although the fact that he came to us as a patient first is unusual. So I'm going to hand it over to Keith. Do we have him on the line? He's going to first present a little bit more of a deep dive than I did on our technology plans, and then we'll shift gears and have the roundtable discussion.
Hi, thanks, Ivana. Good morning, good afternoon, good evening, everyone. It's great to be here and to be able to kind of present just a few slides that frames the technology strategy that we've been working on at Praava, that we really believe will cement Praava as a healthcare disruptor, not just in Bangladesh, but in the region. Hopefully the slide you can see in front of you really illustrates the key technology components that underpin and delivers Praava's patient journey. Given the uniqueness of our brick and click model, our technology stack delivers everything you would expect to see in a clinic or a hospital in a more traditional HIS technology stack with components like an EHR, an LIS, and a pharmacy. Layered on top is a range of software and digital products that support the click side of our business. As Silvana highlighted earlier, as a result of COVID, we preponed the launch of digital services such as video consultancy, e-pharmacy, and localized online symptom checker. As a direct result of this strategy, we're one of the few healthcare providers in the country that has architected a greenfield technology stack that I would describe, and when I speak to people, describe it almost as an operating system of healthcare. We've anchored all of our technology around the patient and the patient experience. That is to say, no matter whatever the touch point into Praava, whether it be a patient walking into our hub in Banani, or a call into our call center, or an interaction through one of our digital assets, the technology supports a consistent and best-in-class Praava experience, which in my opinion is one of the reasons that we have consistently achieved an NPS beyond 91. One of the final overarching principles that sits across the whole technology stack is that to deliver high quality, affordable healthcare in an emerging market is the doctor and healthcare worker facing technology must be easy to use, adopt, and nuance to the people that are using and interacting with the technology. We spend a lot of time really nuancing our kind of healthcare professional facing layer of technology, really to drive adoption. You can have I've worked in Bangladesh and in emerging and frontier markets for over 10 years in health tech. You can have the best technology in the world, but unless it's nuanced to those healthcare professionals that will use it on a day-to-day basis, it never really gets adopted. And we spent a lot of time and effort really getting that right. And it's also built on a data strategy and interoperable data standards that you don't really see in health systems like places like Bangladesh. So I think we're one of the few, if not the only provider that's really architecting, in a greenfield place like Bangladesh with, true kind of data, with a true data strategy, thinking about interoperability. If I can jump to the next slide, please. This slide depicts at a very high level our tech roadmap in the near to medium term. Our short-term strategy is really to leverage up the data opportunity that we have at Praava. Given we sit across so many parts of the healthcare value chain and the patient journey, we've got a huge opportunity to build almost what I describe as a longitudinal view of data across a given patient or population. We're in the process of structuring our data based on interoperable data standards and really bringing all of our data sources, and we have many across our technology stack, into a single health lake. As we mentioned earlier, we see digital as a way really to take Praava beyond and outside of the geographical constraints of our regions, of where our hubs are located, where our spokes are located. We're actively working on the next iteration of the patient app, which will stitch together beautifully kind of all of our digital services, inclusive of things like video consults, e-pharmacy, home care services. And we see a really huge opportunity to leverage the brand equity that we've spent years curating and use the new version of the app really to push Praava into the tier 2 and tier 3 cities across Bangladesh, not just to drive patient acquisition, but also to unlock really for the entire population, the best and affordable healthcare to people that up until now have had either no or limited access to it. In the medium term, we're also looking to upgrade our kind of hospital information stack. We see huge opportunity in new innovations and standards like FHIR FHIR to unlock data interoperability, but we also feel the real need right now to upgrade core parts of our stack, really to future-proof us to be ready for the forecasted growth that we know is coming. Not everything we're going to build ourselves. I think it's really important to say that we plan to use a combination of best-in-class turnkey solutions, battle-tested open source systems, and a few components that we've built ourselves, again nuanced to an emerging market use case. Last but not least, we want to leverage up AI and machine learning that can have future applications to things like preventative care and risk stratification and population health management. We're one of the few providers in Bangladesh that are thinking and building a stack in this type of way, where in a world that access to health data, and particularly data around South Asian epidemiology, is in huge demand. And we already see inbound requests given the lack of providers that have the data that's usable from companies and third parties all around the world, really looking to leverage up kind of South Asian epidemiology data on the kind of scale that we think we can get to.
So much, Keith. I think that's a really, really amazing introduction. Hopefully whets everyone's appetite. I'd like to introduce the rest of our esteemed panelists, all of whom are members of Praava's Global Advisory Council. I think maybe I'll start with Shwetank because he's the one I've known the longest. Shwetank is the co-founder and general partner at Leo Capital, which is a India-focused technology fund headquartered in Singapore. I've known Shwetank since the very beginning of my journey. He also previously ran more than 100 primary care clinics. He was the COO and co-founder of a primary care clinic chain across India and has been a wonderful friend to me since that time. Sitting next to me is Dr. Kurt Herzer, who's the Senior Advisor of Data at the Centers for Medicare and Medicaid. I met him when he was previously the head of population health at Oscar Health. He's also a fellow at Johns Hopkins School of Medicine. Dr. Fred Hirsch is on the lower left of our screen here. He is a product leader focused on global health at Google Health. And I met him when he was the head of product and the chief medical officer at Telenor Health, which is also where Keith was, formerly the CTO, which was Telenor's bet on emerging markets healthcare, starting out in Bangladesh. He's also a member of the WHO's digital health roster of experts. We also have Frederick de Bong, who I met most recently. He's the co-founder and chief product officer at Hi Health, which is removing payments in European healthcare systems, and was the co-founder of MySugar, which exited in 2019 to Roche. It's the biggest mHealth exit in Europe to date, actually. Last but certainly not least, we have Lorraine Marchand, who is the general manager of life sciences at IBM Watson Health, which I guess is soon to be known by another name, but I think still is IBM Watson Health. She's an adjunct professor at Columbia Business School and the author of the Columbia Business School case on Praava, actually, and formerly served as an executive at Bristol Myers Squibb, IQVIA, and the NIH, and also is the author of a book coming out later this year on the innovation mindset. So we're very lucky to have all of you here with us. Thank you for being part of our journey. I'll just open up with an open-ended question in terms of how do you feel Praava's work is fitting into what's happening in digital health globally? Maybe we can start with Dr. Fred Hirsch.
Sure. Thanks, Silvana. Wonderful to be here. Sorry I couldn't be there in person. And good day to everybody that's in the room. I mean, I think that what we're seeing very much in terms of the landscape around global digital health is that there's a lot of enthusiasm for the role that technology can play, really as an enabler. I think that what we've seen certainly the last kind of 2 years has shown us that it's not a question of how technology, whether technology is going to play a role in healthcare, but rather really kind of how it's going to fit in. And I think it's about recognizing that healthcare is still a very personal business, right? I mean, it's about human touch, it's about human connection, and these things are really important. And technology can certainly help to address a lot of problems, but I think what we need to do is figure out really how to seamlessly integrate the opportunity that technology provides into the delivery of care. So I think it's we see around the world huge gaps in terms of access to care, in terms of the quality of care that is delivered. And I think across these domains, there's so much opportunity for technology to kind of help to address that. And I think, the model that Praava demonstrates, the kind of brick and click, but really that kind of integration between these two, is really exciting for, new models of primary care in emerging markets.
Thank you so much. Shwetank, how do you feel generally about the broader health tech opportunity across emerging markets, sitting in your investor's seat?
Yeah, thanks for the wonderful introduction, Silvana. It's great to be here. And it's been great to see the progress Praava has made since, the 8 odd years we've known each other?
Yeah, hard to believe, but we haven't aged at all, right?
No, not at all. 21 as always. So congratulations again on all the progress. Picking up from Fred's point, I was reading a recent Lancet study which said that there are about 6 million deaths per year due to poor quality healthcare. This is a major pandemic.
Yeah.
It's a serious issue, which just because it happens, like COVID is such a big deal and we've shut down economies because of it, but this is hidden, so it doesn't get that kind of attention, but the numbers are as large, if not larger. And that to my mind, is the opportunity there. And this is what I love about how Praava is thinking about building a quality first healthcare system. And, across the emerging markets, there is a huge opportunity to rethink and reimagine primary care, rebuild it from, the ground up effectively with that sort of with your brick and click approach, which ultimately is the right approach for healthcare. You do need centers. I don't think it can be completely virtual. I think we're just scratching the opportunity of what can be achieved, and there is enormous ability to sort of build primary care, specific chronic care outcomes, use the data that digital devices provide to truly, to Dr. Ishrak's point, make us on the wellness and prevention side of things rather than, dealing with very sick patients and trying to make them recover. That's the opportunity that's there from an investing perspective.
So on the data point, I'd love to pick up on that. Professor Marchand has also worked with our team. How can we take advantage of the opportunity we have to build smartly from the beginning, given that we're not dealing with an archaic healthcare system? I mean, we don't have a ton of digital data in our country to start with.
Yes, well, Silvana, I just want to also thank you for inviting me to the panel. And I had an opportunity to hear some of the early sessions, and I was very intrigued and interested. So congratulations on such a well-developed and designed investor panel. And when I think about data, particularly from the perspective of IBM Watson Health, where we deal with data and AI and the technology to enable that day in and day out, I really do think that it's very exciting, the opportunity that Praava has to build what I'm going to call the data layer cake from the ground up. because there is absolutely an opportunity to learn and benefit from what we might describe as some of the mistakes, the tried and true efforts of a lot of the Western counterparts and in countries like the US in particular, that maybe came at EMR from more of a financial accounting perspective. And while that is definitely an aspect or a benefit, I think that the model that you're envisioning is so powerful because number one, the patient will own their own record. And I really don't know any other system where that exists. And it's certainly something that we're aspiring to in the US. And it's an initiative at Watson Health to develop the intelligent health record that the patient owns and manages because of the power of that, because of issues that we have with quality of care, which we just discussed. So that's a really important component of it. I think this idea of the layer cake, which can be the clinical data, the imaging data, one of the speakers talked about the ability to gather genomic data, really enriches the value and utilization of that data for any number of use cases, whether it's a provider in your system that wants to be able to provide better care, more precision type of intervention, whether it does become a payer. And I just wanted to pause on that a moment because I was listening in when one of the participants asked who was going to benefit. And you talked about the fact that the patients would benefit from the system. But there was also a data point shared that I think if I was hearing correctly, about 20% of the payments do come from corporations.
That's correct.
That have a vested interest in having a healthy population. And we certainly see that as really powerful. I mean, in the data ecosystem that we've built, it is the employers and the payers that are prime users of this data because it now allows them to do benchmarking. They can look at quality care. They can see it, who's responding to diabetes treatment and who isn't. So the ability for the Bangladesh economy to continue to grow and for corporations to have a vested interest in a healthy population, I think that's just a really powerful value proposition. And I think that data in their hands and hopefully with corporations continuing to want to invest in the population's healthcare will really be an impetus for them to have a healthy populace that come and work for them, but also to contribute to the ecosystem that you're developing. And then I think the final point is the other important aspect of the use cases, and it's an area that I spend a lot of time thinking about with my biopharma med device background, but it is the manufacturers of products. And they increasingly are dependent on this real world data, whether it's designing their product, choosing the populations that are going to benefit, again, any number of use cases. And so again, being able to do this right from the ground up and be able to future-proof it and design it so it's fit for purpose for these various use cases, I think is really powerful, exciting, and I think it's going to have an exponential impact on the value, and I mean the economic value that Praava will be able to garner for this data, while at the same time it's achieving its mission of putting this data in the hands of the people for whom it belongs, and that's the consumer or the patient.
Absolutely, thank you. And I understand on the genomic data side of things that there is a scarcity of data on the Bangladesh genome, actually. So fully agree in the opportunity there. Frederick, would love to hear from you. What is it about Praava's work that's gotten you excited and brought you along with us on this journey?
Absolutely. So thank you so much for inviting me to join today. It's an honor. I just spent 2 days at one of the biggest digital health and health IT conferences in Germany. And the tenor across all hospital information systems, around consultants and all the companies there, is that we spend 95% of our time trying to bash archaic systems into order to be able to do anything. And then there's maybe a percent of innovation, maybe once a decade. And that is the tenor of these established systems. I've worked in two companies and co-founded two companies pushing user-centric changes in healthcare, in diabetes care, diabetes management, as well as in healthcare payments. User-centric. And it's always hobbled by having to somehow fit into the existing systems. By having the opportunity to work with you guys on creating the best foundation from the ground up, and that I think is the tenor of this panel so far, from the ground up. It enables such a tremendous change and an ability to address things as they happen and not 2 decades later.
Right.
And that is really what excites me.
Absolutely.
Having the ability to work with you guys on that is fantastic.
Oh, and Silvana, if I can just jump in, I just realized I'll underscore a point. I think that the closed system, and what I mean by that is the closed healthcare system that you've been able to develop with the labs, the pharmacy, being able to really take care of the patient completely and their entire family is also really powerful. That doesn't exist everywhere either, as we know. And it's really been why the UK Biobank and the UK system, which again has been a closed healthcare system and has allowed them to collect data from patients much more seamlessly than in fragmented systems, has been really powerful. And if we look at that UK Biobank as even a comparator of the value and the ability to look at that data, I like to just put that out as a metaphor for what I think it is you're going to be able to do.
Thank you. And Dr. Kurt Herzer, I'm curious if you can share with us a little bit about how you think about the use of technology to build value-based care in a more meaningful way. And maybe you can share a little bit of some of what the work that you've done in that regard.
Sure, absolutely.
I think it is, yeah.
Okay, I feel like we're on a throne up here. In a way, I'm just picking up on the same theme that was said. When I was at Oscar, we were building everything from scratch. We were building things from the ground up and saw the immense value in that in so many different ways. Now being at the largest healthcare enterprise on the planet effectively, it's the exact opposite. The systems are from the 60s. There's still 15 mainframes running, compiling code. The Medicare claim system is 8 to 9 million lines of COBOL that no one really understands, and 4% of US GDP flows through this thing every year. And so you see the effects of scale in a totally different way, and all the legacy problems that we have to deal with, so that we can't do the things that really can make a difference in some cases, or that we're boxed in, at least technologically. But when I think about value, I always go back to, it's a bit stylized as an equation, but it's the health outcomes, the quality, and the experience you're trying to generate over the cost effectively that you're putting in to achieve that. And that's both your medical costs and your administrative costs. And everyone everywhere, whether you're payer, provider, regulatory state, are somehow working around this equation. They're hopefully trying to increase the numerator, decrease the denominator, at the very least, maybe hold one of them constant while doing the other. But in some way, you have to navigate that, and you have to think about how exactly you're going to do that. And usually the how comes through in 3 ways, or at least I like to look at 3 ways, and this gets directly to your question. One of those is the underlying technology and the technology stack. The second is how the data that's usually collected from that tech stack and used, used ultimately, how it's organized, how insights and meaning are created from it. And then the third piece is the clinical piece, right? And I think what's so compelling to me about Praava is that it owns so many aspects of that clinical piece, of that delivery system side, whether it's physical or virtual. But you really need all 3 of these to work with some degree of synergy and to be humming to really, kill that value equation and really win in the marketplace. And I think that's where not having the constraints of tons of legacy systems, being able to build this stuff with scale in mind, but also thoughtful in terms of how that data is being collected, how it's being assimilated into models to improve the clinical care, and really managing all 3 of those things really well. We just don't see many great examples of that being done really effectively. But I think there's a real opportunity here, more so than in some other areas where incumbents just, it's really hard for incumbents. Whether you look at the hospital side of the system, delivery side, hospitals, health systems, really good clinically, their tech and data really stinks. It does. Like they can't figure out how to get data out of EHRs, and that severely constrains them in many cases. So not having those problems, I think, makes a huge difference.
Thank you. We have about 2 minutes for questions, I think, or maybe 3 minutes. Badrul, please. I'm going to wait for the mic, maybe. Thank you.
As someone who works with healthcare data and with AI in particular for the US providers, I've had the opportunity to see some of Praava's things in action in Dhaka. So I am pretty envious about, building everything from the ground up, kind of what Dr. Ishrak was saying and what you're saying here, not having the legacy issues. The challenge is, of course, going to be getting that data and really getting the insights from it. I really just wanted to say that this is a tremendous opportunity to see something happening from the ground up like this, because I deal with the challenges in the U.S. healthcare system, and it's not easy, and particularly in value-based care for providers, it's tough. But I think it's like the cell phone analogy that Dr. Ishrak was using. Bangladesh and Praava may have that opportunity to actually leapfrog and get to a better state of health for the average Bangladeshi. I think congrats on Silvana for doing that.
Well, thank you. It's an opportunity. I think we're just getting started. So thank you for that comment. I appreciate it. Any other questions? Someone might have a question on Keith's presentation from the beginning as well. But we're also happy to continue the conversation offline with all of you. So thank you so much for being here in person, Kurt, and thanks to all of you. We have a couple of people joining in from Singapore where it's very late now. So thank you so much for doing it, and hope to see you all in person soon. I hope to be in Singapore soon, so hopefully Shwetank and Fred will have a chance to catch up.
Look forward, Silvana. Thank you.
Thank you all.
Thank you.
And thank you so much, Kurt. I'm going to stay up here.
Okay.
Thank you. So we've managed somewhat miraculously, and thanks to the Chatham team, to stay by and large on time. So quite impressive. I wanted to just open it up for questions that anyone might have for me. If there aren't questions, happy to just, more informally catch up. People may want to meet and get to know Dr. Samin and Dr. Zahid better. I would if I were you, because they're just wonderful people. But also happy to spend a few minutes answering questions if you have them. Yes.
So Silvana, what is the next steps in terms of the capital raise? Are you going to be traveling around the U.S., going to Asia? What are some of the things?
I am in the U.S. for the next few weeks, focused on raising money for the next 2.5 weeks, and then I'll be back in Asia. And so that, yes, I will be going to Singapore, and I'll be I'm just got invited to Davos, so I'll be in Europe for that. So I will go wherever serious investors want to be, but I think they should actually come to Bangladesh. I honestly think the best thing is for them to come and see the business and meet the team and get to know what we're building in a different way.
Could you talk a little about how one would go and
Yep. Sure, yeah. So I don't think they've opened up visa on arrival yet. That's right, Doctor? They still haven't opened up visa on arrival, but it's not very complicated. You can usually get a visa if you're close to a consulate or an embassy within a day. And then generally from the US, you fly through the Middle East, Doha or Dubai. From Europe also, there's some direct flights from London, but I recommend flying through Doha and Dubai. It's a little bit more comfortable. But it's pretty easy. It's a long journey. I've kind of gotten used to it, so I don't want to downplay it. From New York City, you can get there in about 20 hours time. Katie.
Thank you. I think there was a comment in the beginning talking about the lab, about how some of the technology was just absolutely not present, and then Praava brought it in, and now a lot more people are bringing it.
Yes. I think Dr. Zahid made that point, yes.
Right, I remember.
Mm-hmm.
And now there's something similar, I think, about to be on the horizon in terms of the tech and the app, and no one else has it, and you'll bring it in. So we've heard the word disruptor used a lot today. I think the actual word is more like trailblazer, because you're really going in and disrupting, but with a leadership position, which I just think is really exciting, Silvana. And everyone here, I don't know about anyone else, but I can just really feel the excitement in the room, on the screen. Like, there's a lot of really smart people very excited about the future. So I just wondered if you could talk just a little bit about like how you see that future and Praava going in, not just as a disruptor, but really as a trailblazer and what that means for you and for the company?
So I will be honest with you. So just, I mean, many of you know this. I think the business has gone through a very transformational phase, and especially during COVID, it was lots of ups and downs. Cash flow was a challenge. Human resource management was a challenge. People getting sick. I mean, all of it, right? But I think we took advantage of the moment and we served our community in a really meaningful way, and it really catapulted our growth. And we're just grateful that we had the opportunity to serve our community during that time. But it also, fundraising was challenging during COVID, and so we managed to get the business into a position where we don't need so much cash to keep it going. We're mostly sustainable, more or less, and we're bringing in small amounts of capital to keep things alive, but we're not able to move as quickly as we need to without an injection of capital, to be frank. And so that's why I'm fully focused on raising this round to help us really capitalize on the opportunity before us. I hope that's come across today, how excited we are and how much opportunity we see. It's challenging to take advantage of that without a substantial injection of capital at this time. So I'm laser focused on that, but the team is ready and waiting. Today is our medical director's birthday, and we're hoping that will bring us some good luck, that we can raise some excitement among investors and some of you here to really join us on the journey. Because I think everybody is ready and waiting for that next phase. I think we talked about being process driven. It's really true. We spent a lot of time getting things right, and now we're ready to take it to the next level. Thank you. Paul. I think she's almost here. You guys are very quick. Thank you.
What form of capital are you looking for? Are you just looking for equity at this stage?
We're looking for primarily equity. We do have a debt facility locally. It's a $3.5 million local debt facility that I have personally collateralized. We would be happy for a takeover of that on better terms, but it's challenging, as we've talked about in the past. I think, Paul, the terms are not bad. It's 9%, and when you take into account it's DACA denominated, you take into account inflation. It's hard to get dollar-denominated debt at much favorable terms to that. But we're looking primarily for equity. So we're looking for 15 million in equity. We could start with 5 or 10, to be honest, but the full amount is 15.
Okay,
thank you. And again, that's for the Singapore shareholding company.
We have a comment that came in earlier today that I was asked to read from Monty Simus from Bayet Group.
Oh, yes, wonderful. He's been to Dhaka and visited us, actually.
He mentions that. So he says, I've had the privilege of visiting the Praava team in person and as a frontier markets investor. I was impressed by two things in particular. One, you have discussed branding this morning, but I found that you were building a truly aspirational brand, not just in terms of customer recognition, but in terms of team building. I found you and the team to be committed to building a world-class brand and a company which attracts the best and encourages people to develop their career path. And two, the scalability of the model internationally in other frontier markets. I think your business is much more than just Bangladesh, but other frontier markets as well. It is important to think broadly about the opportunity ahead.
Thank you. That's wonderful. I think that's actually maybe a great note for us to end on. I would just like to highlight the cards that are, for the people who are in person, the cards that are on your table. On the back, there's a QR code that you can scan if you'd like to access to our deck. Of course, you can always email me and I'll send it to you as well. We will be following up with the virtual participants with the same. But thank you all for your attention and time. It's hard. We're so excited about our business. It's hard to tell the story in 3 hours, but hopefully you've gotten a taste of it and you'll come see us in Bangladesh. Thank you.